The dog had been trained by the United States Army to trust no one quickly. 3 years of combat deployments, 2 Purple Heart citations for his handler, and a behavioral file thick enough to stop a door Sergeant Kodak was not a dog that walked toward strangers. The moment the retired military working dog entered the emergency hallway of Harlow Veterans Medical Center, he stopped. His nose went up. His entire body went still. And then, ignoring every command his handler gave, the animal walked straight past a room full of doctors and officers and lowered himself gently, deliberately at the feet of the quiet new nurse nobody had bothered to learn the name of yet. The nurse didn't flinch. She didn't reach for him immediately. She simply looked down and said, very softly, "Hey, buddy. Long time." Nobody in that hallway understood what they had just witnessed. Nobody except the dog. Before this story goes any further, if you've never been here before, hit that subscribe button right now, because this channel tells the stories that stay with you long after the screen goes dark. Drop a like on this video and leave a comment below with your city and country. I genuinely want to see how far this story has traveled. Every comment means someone new found their way here, and that matters more than you know. Now, stay with me. Because what happens to this woman over the next several weeks is something you are not going to want to miss. Harlow Veterans Medical Center sat on the eastern edge of Caldwell, Montana, close enough to the foothills that on clear mornings the peaks looked like they were leaning in to listen. The facility was a mid-sized operation, not large enough to have a trauma tower, not small enough to be dismissed, and it served a dense population of veterans, active duty personnel rotating through regional assignments, and civilians who lived in the surrounding towns. The staff was a mix of career military medical, former service members who'd transitioned to civilian healthcare, and new hires brought in to cover the chronic shortage of experienced trauma nurses that had been quietly strangling the department for 2 years. Nora Vega arrived on a Tuesday in late October. She drove herself in a 12-year-old pickup truck with a cracked passenger mirror and a bumper sticker from a national park that had been half peeled off by someone who apparently changed their mind. She wore dark jeans, a plain gray long-sleeve shirt, and carried her paperwork in a manila folder that had been folded and unfolded enough times that the crease line had gone soft. She was 36 years old, 5'6", and had the kind of posture that didn't announce itself, not military straight, not slouched, just quietly balanced, like someone who had spent years learning to move without drawing attention. The HR coordinator, a younger woman named Petra, met her at the front desk and walked her through the standard onboarding with the mechanical cheerfulness of someone who had done it 400 times. "You'll be in the emergency department. Trauma rotation," Petra said, without looking up from her tablet. "Supervisor is Dr. Callum Dryce. He'll want to meet you this afternoon. The department's been short-staffed since August, so be prepared to hit the ground running." "That's fine," Nora said. Petra glanced up, apparently expecting more. She got nothing. She looked back down at her tablet. "Orientation packets in your locker. Do you have any questions? Where's the supply room?" Petra blinked. "Excuse me?" "The trauma supply room. I like to know where things are before a shift starts." It wasn't rude. It wasn't aggressive. It was just a question from someone who wanted an answer. Petra recovered, gave her the location, and that was that. Nora thanked her and walked toward the emergency wing without looking back. The emergency department at Harlow was shaped like a wide L, with the main trauma bay at the joint and 2 long corridors running off each side. The morning shift was already running hard. 2 ambulances had come in within the hour. A construction worker with a compound fracture and an elderly man in respiratory distress, and the floor had that particular compressed energy of a department where everyone was working at 90% just to keep pace with 80% of what was coming through the doors. Nora stood at the edge of the main floor for maybe 45 seconds, reading the room. She clocked the supply cart positions, the monitor stations, the 2 nurses who were visibly running behind, the 1 ER doc who had his back to a patient while typing something that was clearly not urgent, and the charge nurse at the central station who was trying to field 3 things at once. Also noticed that the oxygen line on Bay 4 had a kink in it that nobody had caught yet. She walked over, straightened the line, and checked the connection. Patient in Bay 4, an older man with frightened eyes and an oxygen mask, fogging with each shallow breath, looked at her. She gave him a small nod, not a smile designed to reassure, just an acknowledgement, one person to another. His shoulders dropped a fraction. She moved to the central station. "I'm Nora Vega. New trauma nurse, first shift. What do you need covered? The charge nurse, a compact, sharp-eyed woman named Darlene Ossie, who had been running the floor since 6 in the morning, looked at her for a beat that was longer than a standard first-day greeting. Bay 2 needs vitals checked and a line drawn. Bay 7 has a patient who's been waiting on pain management for 35 minutes because we've been short. Comfortable with a 16 gauge? Yes. Then start there. And Nora did. She wasn't flashy about it. That was the first thing Darlene noticed. Most new nurses in an unfamiliar department had one of two energy signatures. Either they over-explained everything they were doing, narrating their competence out loud, or they went too quiet, and you had to check on them every 10 minutes to make sure they weren't drowning. Nora had neither. She moved efficiently, charted accurately, communicated in exactly as many words as the situation required, and did not ask anyone to hold her hand. By 11 o'clock, she had helped clear 2 pending patients, caught a medication discrepancy in a chart, and assisted with a procedure that had been delayed for 2 hours because the scheduled nurse was held over in post-op. She didn't announce any of it. She just did it and moved to the next thing. Dr. Callum Dryce noticed her at noon. He was 47, sandy-haired going gray at the temples, with the particular brand of authority that came from having been the loudest and most confident person in every room for so long that he had stopped checking whether it was warranted. He was not a bad doctor by any objective measure, his diagnostic instincts were solid, his patient outcomes were acceptable, and he had the kind of easy, surface-level charm that made hospital administrators like him. But he was the kind of man who used words like just a nurse without hearing himself say them, and who had a very firm internal hierarchy that he enforced with enough consistency that most of the nursing staff had learned to stay in their lane around him. He approached the central station where Nora was reviewing a chart and looked at her the way people look at something they didn't order arriving at their table. "You're the new hire." "Nora Vega," she said, not looking up from the chart immediately. She finished the line she was reading before she turned to him. "Dr. Dryce." Something crossed his face at that brief, barely visible. He didn't like that she'd finished reading before responding to him. "Darlene says you're out of billings?" "Originally, yes. What kind of trauma experience are you carrying?" The file was a little thin. Nora held his gaze. "Enough. That's not an answer." "It's the answer that fits the question," she said. "You'll see what I can do when the next critical comes in. That's how it works in any department." Dryce stared at her for a moment. Not with respect, not yet. Not him, but with a recalibration. He was used to 2 nurses being nervous around him, deferential in a way that confirmed his place at the top of the room. Nora was neither nervous nor particularly interested in where he thought he stood. She wasn't combative about it. She was just indifferent, in a way that was almost more unsettling than pushback. "We'll see," he said and walked away. Darlene, who had overheard every word while pretending to update a schedule, said nothing. She made a mental note. The first 2 weeks passed without incident, which was its own kind of event because nothing about Harlow's emergency department was structured to allow 2 incident-free weeks. Staff was stretched, the caseload was heavy, and the facility was in the middle of a contract dispute with 3 of its major suppliers that had left 2 pieces of diagnostic equipment in bureaucratic limbo. Dryce blamed the administration. The administration blamed the procurement office. The nursing staff blamed everyone and kept doing their jobs regardless. Nora became a known quantity on the floor, faster than was typical for new hires. The other nurses liked her, without quite being able to explain it. She wasn't warm in the conventional sense, didn't do birthday cards or linger in the break room for casual conversation. But she showed up early. She didn't leave coworkers hanging. And if something needed doing, and nobody was covering it, she covered it. She also had an uncanny knack for reading patients' levels of distress before the monitors caught up, which made Darlene trust her in the fast-moving moments that define trauma nursing. The veterans especially seemed to respond to her. There was a particular set of patients who cycled through Harlow older service members with long medical histories, younger veterans with injuries that hadn't fully healed, active duty personnel referred over from the regional base clinic for specialist care, and many of them had a guarded quality that took time to crack. Nora, the guard often didn't go up in the first place, spoke to them differently than she spoke to other patients. Not softer, exactly. More direct. Less clinical performance, like she already understood the subtext of what they weren't saying. A veteran named Roy 63 years old with an above-knee prosthetic and a history of phantom pain that had been poorly managed for years, told his physical therapist after one of Nora's shifts that the new nurse was the first one who didn't look at me like something broken. The physical therapist passed it to Darlene. Darlene filed it away. Drace, meanwhile, was building a different case. He had asked questions about Nora's background and gotten answers that didn't fully satisfy him. Her file showed a nursing degree from a Montana state program, a clinical certification, and several years of civilian hospital work in Billings. There were no gaps that should have raised flags. But something about her competence felt to him like it was running at a frequency he couldn't tune into. And that bothered him the way any unexplained thing bothered a man who believed the world was primarily his to understand. He started paying attention to her in a way that wasn't mentorship and wasn't surveillance, it was something in between. He watched her in trauma calls. He reviewed her charts. He asked other staff members, with a casualness he thought was subtle, but wasn't, what they made of her. What he found was nothing negative, which somehow made it worse. 17 days after Nora's first shift, Druss called her into his office. It was a small office medical reference books, a plant that needed water, a framed photo of Drace at a golf course. He sat behind his desk with his hands folded in a way that was supposed to convey authority and instead conveyed rehearsal. "Sit down," he said. Nora sat. "I'm going to be straightforward with you." He paused the way people do when they've planned to say they're going to be straightforward and then need a moment to line up the actual words. "Your work is adequate. The charts are clean. The patients aren't complaining. There's something about your approach that doesn't line up with your background on paper." Nora waited. "You move like someone with specialized training," he said, "not community hospital training, and your instincts in trauma situations are." He seemed annoyed by the word he had to use, advanced. "Is that a problem?" "It's a discrepancy. And discrepancies in a clinical setting are my business." "My credentials are on file," Nora said. "Cleared by HR and the credentialing board before my first shift. I know what's on file." He leaned forward. "What I'm asking is whether what's on file is the complete picture." The room was quiet for a second. "Dr. Drace," Nora said, with the particular patience of someone who has had this conversation before and has stopped finding it worth raising their voice over. "I'm here to take care of patients. What I'm doing. If there's a specific clinical concern about my work, I'm happy to address it. This is something else. I'd appreciate knowing what it is so I can deal with it directly." He studied her. "You're very controlled. I try to be. It reads as evasive. That's your reading." He sat back. "I'm going to recommend a supervised rotation. 30 days. Everything you do gets reviewed." Nora looked at him. Her expression didn't change. "Okay." He had expected resistance. The lack of it seemed to irritate him more than resistance would have. That's all he said. She stood, thanked him with the minimum number of words, and left. In the hallway, outside his office, she walked back toward the trauma floor and did not allow herself to think about the fact that her hands were slightly cold. It was a physiological response. It didn't mean anything. She had stood in front of commanding officers during debriefs with incoming fire, still audible, and kept her breathing even. A hospital supervisor in a golf course office was not the thing that was going to break her. Darlene saw her face when she came back onto the floor and made no comment. She handed Nora a chart, and they both went back to work. The supervised rotation started the following Monday. It was conducted by a senior nurse named Graham, a large, careful man who had been at Harlow for 11 years and who seemed genuinely embarrassed by the assignment. He kept the observation notes brief and factual. He found nothing wrong. He filed the report. Drace reviewed it, made a note that the supervision would continue through the full 30 days, regardless, and moved on. On day 11 of the rotation, the working dog arrived. His name was Kodak, a 9-year-old Belgian Malinois who had retired from active deployment after his handler was medically discharged following an injury sustained overseas. His current handler was a young Army liaison officer named Lieutenant Dex Farrow, who had brought the dog to the hospital for a routine wellness check at the base clinic's satellite facility that operated out of Harlow's East Wing. The wellness check was a formality. Kodak was physically healthy, had been evaluated months prior, and the visit was mostly paperwork. Farrow brought the dog through the main entrance rather than the side access because the parking on that right side was closed for resurfacing. That was the only reason Kodak was in the emergency hallway at 2:14 in the afternoon. Pharaoh had him on a working lead, a flat military spec leash with a tactical grip, and Kodak was moving the way well-trained military dogs move in civilian environments, alert, controlled, unhurried. He was not reactive, not skittish, not distracted by the smells and sounds of a busy hospital, because he had spent years in environments far louder and stranger than this. Then something changed. His nose went up. His body went still, stopped mid-stride, and Pharaoh, who had been talking to a hospital coordinator, felt the leash go taut and turned. Kodak's attention had fixed on something at the far end of the hallway. His ears were forward. His posture had shifted into something that Pharaoh had seen before, but couldn't categorize. In the moment, it wasn't an alert for a target. It wasn't anxiety. It wasn't the play-seeking behavior that sometimes emerged in retirement. It was something closer to recognition. Something with memory in it. Kodak, Pharaoh said, firm. The dog's ears rotated at the sound, but his gaze didn't move. Kodak, sit. The dog sat for about 4 seconds. Then he stood and began walking forward, pulling with the steady, purposeful pressure of an animal that had decided something. Pharaoh was experienced enough not to yank hard on a retired military working dog in an unfamiliar environment. That was how you got a situation. Kept the lead steady and moved with the dog, speaking in a low, even voice, watching where Kodak was going. Kodak walked 30 feet down the hallway, past a supply cart, past 2 nurses in conversation, past a resident typing on a wall-mounted screen, and stopped in front of Nora Vega. Nora was standing at the chart rack, making a note, and she heard the dog's nails on the linoleum before she looked up. When she saw him, something in her went completely quiet, tense, quiet. She lowered the chart slowly to her side and looked at the dog, really looked at him in the way you look at something you once knew very well. Kodak lowered himself, not collapsed, not shaking, lowered himself with intention, the way a trained animal chooses to defer to someone it has decided it trusts, which in military working dog terms meant something more precise and more weighted than what it would mean for a pet. He lay across her feet. Nora crouched down. She put one hand on his side, flat, steady, and said something quiet enough that Pharaoh, who was 4 feet away, couldn't hear it. The dog's tail moved twice. Slowly, Pharaoh stared. He had worked with Kodak for 8 months. He had watched this animal stay impassive during medical procedures, gunfire simulations, and the chaos of multi-vehicle exercises. He had never seen him do anything like this. Pharaoh said carefully, "Do you have you worked with MWDs before?" Nora looked up. "A while ago," she said. She stood slowly, giving the dog time to adjust, and Kodak rose with her, stayed pressed to her left side. "He's in good shape," she said, looking at Pharaoh now. "Eyes are clear. Gait looked okay from the hallway. Yeah, he checks out physically." Pharaoh looked between the dog and the nurse in a way that suggested his understanding of the morning had just shifted on its axis. "Can I ask where you worked with them?" Nora met his gaze. Her expression was level, not unfriendly, and she answered with the specific quality of someone who has gotten very good at giving true answers that contain exactly as much as they intend to share. "Overseas," she said. "Different context." She handed the chart rack back to the wall and walked toward Bay 3, where a patient had been waiting 12 minutes for a dressing change. Pharaoh stood with Kodak in the hallway for a moment longer than he needed to. The dog watched her go. His tail moved once more, then stilled. Drace had come around the corner at the end of the exchange. He had seen the dog lie down. He had seen Nora crouch. He had seen Pharaoh's expression. He stood with his arms crossed and watched her walk back to the floor without speaking to anyone about what she'd observed. But later that afternoon, he made a call. Nora didn't know about the call. She finished her shift, changed out of her scrubs in the staff locker room, and sat for a moment on the wooden bench before she stood up and pulled her jacket from the hook. The locker room was empty. The overhead light hummed slightly. She looked at her own hands for a second. The way you look at something familiar that you're occasionally surprised it is still yours. The dog had known her. Of course he had. She had worked with Kodak's unit for 14 months at a FOB, in a region she was not cleared to name in civilian company. She had treated his handler when he went down. She had helped stabilize Kodak himself after a blast injury that had left him temporarily unable to weight bear on his right rear leg. She had been part of the team that assessed his recovery trajectory and written the report that eventually got him placed in a qualified retirement program. 14 months, 3 deployments, 41 patients she could name from memory without looking at a chart. She had not planned for him to be here. She had not planned to be recognized. thing about coming back to a life you had taken off. Like a coat eventually, something from inside it reached through. She put her jacket on and left. 3 days later, the phone in the charge nurse station rang at 7:26 in the morning, and Darlene picked it up, expecting a supply update. Instead, a man's voice asked for Dr. Callum Dryce, by name, identified himself only as being affiliated with the Department of Defense Medical Review Office, and asked whether Dr. Dryce has recently made an inquiry about a staff member named Nora Vega. Darlene took a message and stood holding it in her hand for a long moment before she went to find Dryce. He read it without visible reaction. Then he said, "Hold my morning appointments," Darlene asked. Everything, Dryce said, and the steadiness in his voice was doing a job she hadn't heard it do before. Dryce didn't take the meeting in his office. He took it in the small conference room at the end of the administrative corridor, the one with no windows and a table that seated 8, but almost never had more than 3 people at it. He closed the door. He did not invite Darlene. He did not tell anyone else on the floor what the call had been about. And by the time he came back out 90 minutes later, his expression had the carefully maintained neutrality of a man who had received information he was still deciding how to process. Nora was on shift when he came back onto the floor. She was in Bay 6, rechecking the IV placement on a patient who had been admitted overnight with a blood pressure spike that was finally stabilizing. She heard Dryce come through the door, recognized the particular rhythm of his footsteps without looking up, and kept working. She adjusted the drip rate, noted it in the chart, and said something quiet to the patient, a woman in her 70s named Mrs. Albright, who had been anxious since admission, and who had started asking for Nora by name when she needed something. "You don't have to go anywhere soon?" Mrs. Albright asked. "Not for a while," Nora said, which was true for the next 40 minutes at least. "Good." The old woman closed her eyes. "You're the only one who doesn't make me feel like a problem." Nora didn't answer that. She pulled the curtain halfway closed on her way out and walked back toward the central station, where Dryce was standing with his arms folded, watching the floor, with an expression that looked composed from a distance, but wasn't quite up close. He said nothing to her when she passed. She said nothing to him. But the air between them had a different quality than it had the week before, and Darlene noticed the same way. You notice a weather shift, not because anything has visibly changed, but because something in the pressure is different. The rest of that shift passed without incident. The next one did too, and the one after that. Nora worked through the last days of her supervised rotation the same way she'd worked through the first, consistently, without drama, without anything that gave Dryce a clinical foothold for the suspicion that he was clearly still carrying. Graham filed his final report. The observation period closed. The formal supervision ended on a Thursday, noted in the staffing record with the perfunctory efficiency of paperwork that had found nothing worth documenting. Dryce signed the form. He did not speak to Nora about it directly. What he did instead was begin restructuring the trauma assignments. It happened gradually enough that it might have read as administrative routine, a shift in rotation schedules, a redistribution of bay assignments, a new rule about who could be first assigned to incoming criticals without a senior physician co-present. The rule on paper applied to all nurses below a certain seniority threshold. In practice, it applied primarily to Nora because she was the only one below that threshold who had been consistently taking on critical patients and handling them with a competence that exceeded what the threshold was designed to protect against. Darlene brought it to her on a Monday morning, handing over the new schedule with the expression of someone delivering bad news they didn't generate. "The rotation change starts this week," Darlene said. Dryce signed off Friday. Nora looked at the schedule. Her name was there, but the assignments had shifted: lighter cases, more administrative support duties, fewer trauma rotations. Not removed entirely, just reduced in a way that was difficult to argue against, without sounding like you were fighting a bureaucratic process rather than a personal decision. "Okay," Nora said. Darlene looked at her. "You're not going to say anything?" "What would I say?" "Something, anything." Darlene kept her voice low. "Nora, your outcomes in trauma are better than half the nurses who've been here for years." Graham's report was clean. "There's no clinical reason for this reassignment." "I know." Then Darlene. Nora folded the schedule once and held it at her side. "If I push back on this directly, it becomes a formal dispute. That means HR involvement, documentation, a process that takes months and creates noise. I'm not interested in noise." She paused. "I'll do the assigned cases. I'll do them well. That's the answer. Darlene pressed her lips together. She was not a woman who backed down from things easily, and watching someone absorb this kind of deliberate sidelining without fighting, it ran against something fundamental in her. But she also understood, in the way that women who had worked in institutional medicine for 20 years understood, that Nora had just described the only move that didn't cost more than it gained. Fine, Darlene said. But I'm noting the schedule change in the staffing log, with a flag for administrative review. Just so there's a record. That's your call to make, Nora said. She handed the schedule back and went to pick up her first chart of the morning. The administrative cases were not difficult. They were straightforward medication reconciliations, discharge paperwork coordination, post-procedure monitoring, patient education. Nora did them with the same attention she gave everything else, and did not complain. What she did not do was disappear from the floor. She stayed visible, stayed present. And in the moments when the trauma bay got busy enough that the reassigned staff couldn't keep pace, she stepped in not to grandstand, not to make a point, just because there was a patient in front of her who needed something done. Dreiss saw her do it 3 times in the first week of the new rotation. Each time, he said nothing in the moment. Each time afterward, the thing in his expression that Darlene couldn't name got a little harder to look at. On the 9th day after the rotation change, a veteran named Corporal Milo Tate arrived in the emergency department. He was 28 years old, active duty, referred from the base clinic for evaluation of what had been documented as a soft tissue injury to his right shoulder sustained during a training exercise. Came in with a clinic referral form, a duffel bag he kept in his lap, and the specific brand of tightly controlled stillness that Nora recognized the way you recognize a language you used to speak not consciously, just immediately, in the back of the throat. The assigned nurse that morning was a third-year staff member named Petra, who was covering extra hours after 2 colleagues called out sick. Petra was capable and well-meaning, but she was also stretched thin, and when Tate sat in the assessment bay and answered her intake questions with monosyllables that were technically correct and contextually empty, she charted what he gave her and moved to the next task. Nora was passing the bay on the way to the medication room when she saw Tate's face through the gap in the curtain. She stopped. She looked at the chart, clipped to the outside of the bay. Soft tissue injury, right shoulder, referred for imaging and follow-up. No flags. She pulled the curtain aside far enough to speak without fully entering. Corporal Tate? He looked up. His eyes were the kind of tired that wasn't about sleep. I'm Nora. I'm going to get the imaging order started, so you're not waiting longer than you have to. She stepped in. Can you tell me where the pain is at right now, on a 1 to 10? He looked at her for a moment in a way that was slightly different from how he'd looked at Petra, not softer, exactly, but recalibrated in some small way. 4, he said, when it's still. And when it's not, a beat, 7, maybe, 8 sometimes. She looked at his right arm, the way he was holding it, not dramatically, not cradle style the way civilians often held injured limbs, but with the particular careful positioning of someone who had been moving through pain for long enough that management had become automatic. How long has it been like this? The injury was 3 weeks ago. 3 weeks, she repeated, not as a question, just letting the number exist in the air between them. I had a mission cycle. Couldn't come in. She noted his rate of breathing, the slight tension across the jaw, the way he hadn't shifted his weight once since she walked in. Pain in the shoulder only, or does it radiate? Tate looked at the curtain for a second. Down the arm sometimes. Nora glanced at the referral, soft tissue. Imaging recommended. Protocol. She looked back at him. Corporal, I'm going to add a neurological check to your intake and flag for the attending to include nerve conduction in the evaluation. The referral documentation says soft tissue, but I'd like to make sure we're not missing something. He met her eyes. You think it's more than that? It wasn't quite a question. I think you've been managing this for 3 weeks during a missions cycle, and you're here now, which means something changed. I'd rather we look at everything. Something in his face shifted in a way that was so brief and controlled that anyone not looking for it would have missed it. Okay, he said. She updated the chart, put the flag in, and went to find the attending before she went anywhere else. The attending that afternoon was Dr. Renata Wills, a 39-year-old internist who covered D overflow rotations and who had a straightforward manner that Nora had come to appreciate in the 4 weeks she'd been at Harlow. She reviewed the flag without theatrics, agreed with the expanded evaluation, and ordered the additional workup within 6 minutes of being approached. The imaging came back 90 minutes later. The soft tissue injury was real, but beneath it was a partially torn labrum that had been compensating incorrectly for 3 weeks, and the nerve involvement that Nora had suspected showed up clearly in the conduction study. Tate would need a surgical consult and a treatment plan that was significantly more involved than the initial referral had accounted for. Dr. Wills reviewed the results, spoke with Tate, and made the referral. At the end of the process, she stopped at the central station and looked at the flag Nora had added to the intake chart. "Good catch," she said. Nora nodded. He was managing. "They get good at it." Wills looked at her for a moment. She had the expression of someone filing away a data point. Then she moved on. Dryce heard about the Tate case the following morning. He heard about it the way people in authority positions often hear about things secondhand, framed by whoever was doing the telling, with the particular distortion that comes from information passing through a person who isn't sure what the listener wants the story to be. What he heard was that the new nurse had overstepped the scope of an administrative assignment to intervene in an intake that wasn't hers and flag an evaluation that the primary nurse had already completed. He called Nora into his office that afternoon. She sat across from him with her hands in her lap. He had the chart pulled up on his monitor, and he turned it toward her with the deliberate movement of someone presenting evidence. "You flagged Corporal Tate's intake," he said. "I did. You weren't assigned to that bay." "No, I was passing through. And you decided to intervene in an intake that a nurse was already managing." Nora looked at the screen. Tate's results were visible: the labrum, the nerve involvement, the surgical referral that was now in process. "I flagged a clinical concern that turned out to be clinically significant," she said. "Patient has a partially torn labrum and nerve involvement that would have been missed on a soft tissue protocol. That's not the point." She looked at him. "Then what is?" "The point," Dryce said, with the precision of someone who has rehearsed this, "is that you are currently on a restricted assignment. You are not on trauma rotation. You are not authorized to be expanding the scope of other nurses' intake assessments without a clinical supervisor present." Flagged the chart and spoke to the attending before anything was added. "Dr. Wills authorized the expanded evaluation." "Doctor Wills didn't know you weren't authorized. I told her I was on administrative rotation. She made the clinical call regardless, because the concern was valid." The silence in the room had a particular texture. Drace sat with his hands flat on the desk, not folded, flat, like he was making sure they stayed where he could see them. "I'm documenting this as a scope violation," he said. "It will go in your personnel file." Nora sat very still. "A veteran is getting surgery he needed 3 weeks ago," she said. "I understand you're documenting it. Is there anything else?" Stared at her. "You're very comfortable being wrong," he said. "I'm not," she said simply. "That's why I flagged the chart." She stood, thanked him, and left. In the hallway, she walked to the staff bathroom at the end of the corridor and ran cold water over her hands for about 30 seconds. Her pulse was slightly elevated, not from fear, from the particular adrenaline that comes from suppressing a response you could have given, but chose not to. She looked at herself in the mirror. She looked tired, not depleted, just carrying more weight than the outside of her face was showing. She dried her hands and went back to work. The personnel file notation appeared 2 days later. Darlene read it and came to find Nora at the end of her shift. "He filed it as a scope violation," Darlene said. She kept her voice low, but there was something underneath it that wasn't quite controlled. "I know. Nora, this is the second formal action in a month. If there's a third I know, then you know you need to do something. Talk to HR. Talk to the director something." "And say what?" Nora said. "That I caught a clinical problem and got documented for it? That's not a case, Darlene. That's a grievance, and grievances at this level take months and damage everyone they touch." She picked up her bag. "Sit. If he's building something, he'll overreach. That's how it works." Darlene watched her. "How do you know that's how it works?" Nora looked at her for a moment. "Because I've watched people in authority positions make decisions motivated by ego long enough to know they always think they're being strategic when they're actually just accelerating." She zipped her bag. "He'll overreach." She left. Darlene stood in the locker room for a moment after the door closed, then went back to her desk and pulled up the shift schedule for the following week. The overreach came faster than either of them expected. It was a Wednesday, 12 days after the personnel file notation, and it started the way most irreversible things start quietly, with paperwork. Drace submitted a recommendation to the hospital director, Dr. Sonia Asakafor, formally requesting that Nora Vega be transitioned off the emergency department floor and reassigned to an outpatient clinic role at the satellite facility 15 miles from the main campus. The recommendation cited the scope violation, a general concern about the fit between Nora's approach to clinical authority and the needs of the department, and a carefully worded passage about the importance of institutional cohesion in high-stress environments. It was thorough, it was professional, it was the kind of document that people with Drace's institutional experience knew how to write specific enough to have teeth, vague enough to be difficult to dispute in direct terms. Dr. Okafor read it on a Thursday morning. She was a deliberate woman, mid-50s with 22 years in hospital administration, and a particular wariness about recommendations that arrived with multiple layers of carefully chosen language. She flagged it for HR review and made a note to speak with Darlene Osi before she made any decision. Darlene got the HR call at 11:15. She answered every question with the precision of someone who understood exactly what was being asked underneath the questions being asked. Yes, there had been a scope flag. Yes, the outcome had been a correct clinical call that benefited the patient. Yes, the rotation change had preceded the flag. Yes, she had noted the schedule change in the staffing log at the time. Yes, she still had that record. The HR coordinator asked if there was anything else relevant. Darlene thought about it for exactly 1 second. The nurse in question, she said, has the highest patient satisfaction scores in the emergency department for the current quarter. You should pull those. They're in the system. She hung up and went back to her shift. Okafor received the staffing log notation and the patient satisfaction data by end of day. She read both documents in her office with the door closed. Then she called Drace. Nora did not know about any of this. She was working her assigned administrative rotation, processing discharge paperwork for 3 patients, and coordinating a follow-up referral for a 4th. She did the work without visible frustration, without the performance of patience that would have been its own kind of statement. She just worked. When a patient's family member came to the desk confused about a medication list, she stopped what she was doing and walked them through it. When a fellow nurse asked for help locating a misrouted lab result, she helped locate it. She did not make herself small. She just did the job that was in front of her. 2:47 in the afternoon, Lieutenant Dex Farrow came through the emergency department main entrance again. He was not there for a wellness check this time. He was not carrying the dog. He was in uniform Army service dress, not the working fatigues he'd worn the first time, and he was accompanied by another officer, a woman, also in service dress, with a rank insignia that Darlene clocked from the central station as a major. Farrow looked around the floor. He found Nora at the far end of the corridor, standing at the chart rack with a discharge summary in her hand. He walked toward her. The major walked with him. Darlene watched from the station and did not pretend to be doing anything else. Farrow stopped in front of Nora. He looked at her with the expression of someone who has been thinking about how to begin something and has decided that the beginning matters less than the fact of it. Ms. Vega, he said. This is Major Adria Lennox. She's with the Office of the Army Surgeon General. Nora looked at the major. Lennox was in her early 40s, dark-haired, with the particular economy of expression that came from years of institutional medicine inside a military command structure. Extended a hand. Ms. Vega. Nora shook it. Major, I'd like to speak with you, Lennox said. Privately, if possible. It won't take long. Nora looked at the discharge summary in her hand, clipped it to the rack. There's a consultation room at the end of this corridor, she said. 3 minutes. She finished the notation she'd been midway through because it needed to be done, and because the patient it belonged to mattered, regardless of whatever was about to happen in the consultation room, and then she walked down the corridor. Drace had seen Farrow and Lennox come onto the floor. He had seen them approach Nora. He was standing at the edge of the trauma bay with a tablet he was no longer reading, and his expression was doing something complicated that he was not managing as well as he thought he was. He watched Nora walk into the consultation room with 2 military officers in service dress, and he did not move for a full 30 seconds. Then he walked to his office and closed the door. Inside the consultation room, Nora sat across from Lennox. Farrow stood near the door, which was closed but not locked. Lennox opened a folder. I'm going to tell you what I know, she said, and then I'd like to hear what you want to say about it. Nora waited. We received an inquiry from this facility about your professional background, Lennox said. The inquiry came from Dr. Callum Dryce, directed through a Department of Defense medical contact he located through the hospital's administrative directory. The inquiry asked whether your nursing credentials had been verified at a federal level and whether there were any flags on your background in the military health system. Okay, Nora said. When that inquiry hit our office, it triggered an internal cross-reference. Your name is in our system, Ms. Vega, not as a civilian hire. Former personnel. She looked at her U.S. Army Medical Corps. Combat medic specialty. 8 years active. Multiple overseas deployments. Service record closed at the time of your honorable discharge. The room was quiet. Your civilian credentials are valid, Lennox continued. Your nursing license is clean. Your hire at this facility was entirely above board. She paused. The nature of the inquiry concerned us. Specifically, the person asking questions and the context in which they were asking them. Nora kept her voice level. What kind of concern? An administrative official at a veterans medical facility making inquiries into a staff member's military background through unofficial channels while simultaneously placing that staff member on restricted duties and initiating documentation toward reassignment. Lennox closed the folder. That pattern has implications we take seriously. Nora looked at the folder. He's filing a recommendation to remove me from the department. Lennox looked at her steadily. We know how. Because the hospital director contacted our office this morning, asking whether there were any federal considerations she should be aware of before acting on the recommendation. Lennox's expression didn't change, but something behind it did. Dr. Okafor is being careful. Nora sat with that for a moment. Okafor had asked before moving. That was not nothing. What happens now? Nora asked. That depends on some things, Lennox said. First, and I want to be direct with you, we are not here to compel you to do anything. Your service record is your own. What you disclose about your background in a civilian context is your right, not our directive. She looked at her. But there are elements of your service history that have become relevant to an ongoing review of this facility's administrative conduct. Elements that you are the most direct source for. Nora met her gaze. What kind of review? Lennox looked at Farrow briefly, then back. Dr. Dryce has been involved in the care of active duty and veteran patients for 3 years at this facility. The inquiry he made into your background was not the first time he has used unofficial channels to manage information about personnel he considered a threat to his authority. She let that land. There are other cases, other staff members, other patients. A pause. We have been building a picture. Your situation brought things to a point. The air in the room had changed. Nora could feel it in the way she felt pressure changes. Not dramatically, not with panic. Just a clear physiological awareness that the environment had shifted and that what she did next had weight. What do you need from me? She said. Lennox reached into the folder and placed a single document on the table between them. It was a formal consent form, a request for voluntary participation in a federal administrative review. Nora's name was already at the top. Your account, Lennox said. Everything that has happened since your first day here. In writing on record, voluntarily. Nora looked at the form. She looked at Lennox. She thought about Darlene's face when she delivered the scope violation notation. She thought about Corporal Tate's arm and the 3 weeks he'd spent managing a torn labrum through a mission cycle. She thought about Mrs. Albright saying she didn't make her feel like a problem. She thought about Kodak lying across her feet in the hallway, and Farrow's expression, and the fact that a dog had given her away before any person had the nerve to look closely enough. Picked up the pen. She was halfway through signing when the door to the consultation room opened without a knock, and Drace walked in. He stopped when he saw the document on the table. He stopped when he saw the pen in Nora's hand. He stopped when he took in the full picture of what was happening, Major Lennox across the table, Farrow by the door, Nora Vega signing something official in a room he had not been invited into, and for the first time since she had walked through the doors of Harlow Veterans Medical Center, Nora watched Callum Drace look genuinely uncertain. What is this? He said. Lennox looked at him with the calm of someone who has spent decades in rooms where authority was being sorted out. This is a confidential administrative proceeding, Doctor. Drace, you are not authorized to be present. This is my department. His voice was still even, but the control in it was working harder than it usually had to. Any federal review of my staff is conducted without prior notification to the subject of the review, Lennox said. You are aware of that protocol. Dryce looked at Nora. She met his eyes and didn't look away, and what she saw in his face just for a second, underneath the composure he was trying to rebuild, was the expression of a man who had been so certain he was managing something that the moment it started managing him was genuinely disorienting. She signed her name. She put the pen on the table. "I'll need this room," Lennox said to Dryce, "for another 20 minutes. Dryce stood in the doorway for a moment. That was 3 seconds longer than it should have been. Then he turned and walked out, and Pharaoh quietly pushed the door closed behind him. Nora looked at the signed form on the table. Her pulse was even. Her hands were steady. Outside the consultation room, somewhere on the floor, she could hear the sounds of the emergency department monitors, voices, distant sound of an arriving ambulance whose tires she could identify by sound alone, as having crossed the speed ridge at the entrance to the bay. "There's something else," Lennox said. Nora looked up. The major opened the folder again. She pulled a second document out, this one, on different letterhead, thicker paper, with a seal at the top that Nora recognized before she read a word of it. "Your service record was flagged 2 years after your discharge," Lennox said, "by request of the commanding officer of your final deployment unit. There was a recommendation entered at that time for a commendation review. It was delayed due to the administrative closure of that unit and a personnel transition in the reviewing office." She set the document on the table. It was never rescinded. It was waiting for a processing update. Nora looked at the document. She didn't touch it. "The review has been completed," Lennox said quietly. The ambulance outside had reached the bay. Nora could hear the doors opening, voices sharpening into the precise language of incoming trauma. Could hear Darlene's voice cutting through, directing, the floor reorganizing itself around whatever was coming through those doors. She could feel the pull of it, the instinct that had nothing to do with job title or assignment, or the restricted rotation that had moved her to paperwork, just the pull toward the thing that needed doing. She left the document on the table and looked at Lennox. "What's coming in?" she said. Lennox blinked. "I'm sorry?" "The ambulance." "What's coming in?" She stood. "I need to know if they need me out there." Pharaoh's radio crackled at that exact moment. He unclipped it, listened, and his expression shifted. He looked at Lennox, then at Nora. "Multi-vehicle," he said. "Military convoy. Training accident. They're routing 4 criticals to this facility." 4 criticals. Nora was already at the door. The hallway outside the consultation room had already changed pitch. Nora felt it before she fully cleared the door, the particular compression of air that happens when a floor shifts from managed busy to something else entirely. When the standard noise of a working emergency department drops 1 register and gets replaced by a sharper frequency that the body recognizes before the brain names it. She had heard that sound in enough places that it had stopped being alarming and started being informational, the way a pilot reads turbulence not as danger but as data. She moved toward the trauma bay. Behind her, she heard Lennox say something to Pharaoh, but she wasn't tracking that anymore. 4 criticals from a military convoy accident meant at minimum 4 active resuscitation tracks running simultaneously, and Harlow's emergency department, on a Wednesday afternoon, had 2 attendings on floor, 1 in consult, and a nursing staff that was already 2 people short from the week's callouts. She was doing math before she reached the corridor junction, and the math was not comfortable. Darlene met her at the edge of the trauma bay entrance with the expression of someone who had already run the same numbers. 4 inbound, 2 priority 1, 2 priority 2. ETA on first unit is 4 minutes. What's the breakdown? Convoy vehicle rolled during a live fire movement exercise. 2 with crush injuries, 1 with a suspected TBI and facial trauma, 1 with blast overpressure and a compromised airway. Darlene was reading from the radio relay as she spoke. Base clinic stabilized what they could. They're sending a trauma team with the transport, but the team lead is requesting full ER support on arrival. Nora looked at the bay. The 2 nurses currently on trauma rotation, a second year named Priya, and a traveling nurse named Gareth, who had been at Harlow for 6 weeks, were setting up. They were moving efficiently, but they were also visibly recalculating what 4 criticals meant for 2 people. Who else is available? Petra's finishing a post-procedure in Bay 4. Graham's on break. I've already paged him. Wills is the attending on. Crenshaw is in consult, but I'm pulling him. That's 4 nurses and 2 attendings for 4 criticals minimum. I know what it is, Darlene said. Nora didn't pause. I need to be on the floor. Darlene looked at her directly. Dryce restricted your trauma assignment. Darlene. I know. Darlene turned back to the bay. You're covering. If he has a problem with it, He can bring it to me in writing after the patients are stable. Nora was already moving. She pulled a pair of trauma gloves from the wall dispenser, snapped them on, and went to the supply cart to verify what was staged. Airway kit, check. 2 large bore IV set. Chest seal materials, pressure dressings, the defibrillator charged and within reach. She moved 1 unit of O negative from the secondary refrigerator to the bay counter, not protocol for pre-positioning, but the kind of decision that bought 90 seconds in the moment it mattered and checked that the suction unit was functional. Priya watched her do it without comment. Gareth moved out of her way without being asked. They heard the first ambulance before they saw it. Transport came in fast, the bay doors opened, and the Army trauma team came through with the first patient. On a stretcher, a young soldier, male, maybe 22, facial lacerations deep enough that the blood had soaked through 2 layers of field dressing and was still moving. The Army medic, running alongside, had 2 fingers pressing below the jaw angle and was giving a verbal handoff for the stretcher hit the bay threshold. Specialist Darren Krause, 22, closed head injury, suspected from vehicle rollover, facial trauma with active arterial bleed at the left mandibular branch, GCS 9 on scene, down to 7 in transit, blood pressure dropping, no loss of pulse, airway partially compromised, he's got blood in the posterior pharynx, and he's not clearing it on his own. Dr. Wills stepped in, airway first. Vega Nora was already there. She had the suction catheter in hand, positioned at Krause's head, and she suctioned the posterior pharynx with practiced economy 2 passes, cleared enough to see what she was dealing with. I've got partial obstruction, blood pooling. He needs to be intubated. Agree. Get me a video laryngoscope. Wills was pulling on gloves. Priya, get access to large bore. Anacubital if you can. External jugular if you can't. Go. The second ambulance arrived while they were intubating Krause. The second patient, a woman, late 20s, sergeant by the rank on her shredded uniform sleeve, came in with a crush injury to the lower left extremity and a pressure reading that was dropping in real time. The Army medic on her transport was doing manual compression on the femoral and was not letting go. She's got compartment pressure in the lower leg, the medic said. Probable vascular compromise. We tourniqueted at the scene, but the pressure's not holding. She needs a vascular surgeon yesterday. Dr. Crenshaw, who had arrived 40 seconds earlier, took the patient and immediately called for a surgical consult. Gareth moved with him, setting up the secondary bay. The third transport arrived before the second patient was fully assessed. TBI facial trauma. The airway was intact, but the patient was combative, a young corporal cycling in and out of responsiveness, alternating between stillness and sudden physical resistance that made every procedure a negotiation. He had a blood pressure that was elevated in a way that wasn't strength. It was intracranial pressure, and he needed imaging 10 minutes ago. Graham had arrived by then, and Petra was out of post-procedure, and for approximately 4 minutes the trauma bay was running all 3 tracks simultaneously with the particular controlled chaos that looked like disorder from the outside and felt like a very specific kind of precision from inside everyone, moving in overlapping patterns, nobody crossing paths in a way that cost time, every voice clipped to essential information, no performance, no waste. Nora was on Krause's airway, then on the vascular access for the sergeant, then back to monitoring Krause's post-intubation sedation level, while Wills managed the TBI patient's blood pressure protocol. She was tracking 3 patients at once, not because she'd been asked to, but because the gaps in coverage were visible to her and she filled them the way. Water fills the low points in a surface, not dramatically, just inevitably, following the path of what needed doing. The 4th patient arrived at minute 11. He was the one with the blast overpressure injury, and he was the one who changed the temperature of the room. His name, from the dog tags that the medic pressed into Darlene's hand at the door, was Staff Sergeant Victor Reyes, 31 years old. He was unconscious. His breathing was present, but wrong, too shallow, too fast, with the particular asymmetry that told Nora before she reached him that something in the thoracic cavity was not where it should be. The medic giving the handoff had gone to 2 sentences when Nora cut in. Tracheal deviation. The medic looked at her. Slight. To the right. Breath sounds on the left. Diminished. We thought tension pneumo. We needled him at the scene. Did it relieve? Briefly, it's coming back. Nora looked at the chest. The needle decompression site was visible correct position. Second intercostal space. Midclavicular line. The medic had done it right. The problem was that the lung had reaccumulated. A tension pneumothorax that reaccumulated after needle decompression meant the needle was no longer patent, or the underlying cause was ongoing, or both. He needs a chest tube, she said now. She looked for Wills. Wills was at the TBI patient's bedside, managing a sudden blood pressure spike that required immediate intervention and was not in a position to move. Crenshaw was in the secondary bay, with the vascular patient waiting on surgical. The other attending on floor was in a procedure room, with a pre-existing case that couldn't be abandoned. "Who's running him?" Nora asked. Nobody answered immediately. Not because nobody cared, but because in the specific geometry of that moment, every physician in the department was at maximum capacity with patients who would deteriorate if the physician left. "Dr. Wills," Nora said, at a volume that cut through the room without being loud. "Reyes needs a chest tube. Tension pneumo reaccumulating post-field decompression. I need a physician to confirm and order." Wills looked up from the blood pressure intervention. She assessed the situation in approximately 2 seconds. "You're looking at a confirmed tension pneumo presentation?" "Yes. Position of trachea?" "Deviated right. Diminished left. BP drop. HR increasing." "Needle decompression already attempted with temporary relief?" "Yes, reaccumulating." "Then it's a confirmed indication," Wills said. "Orders verbal, I'm authorizing the chest tube. Get the kit." She looked back at her patient. "You've done this before." It was not quite a question. Nora did not answer it. She went to the supply cabinet. The chest tube kit at Harlow was a standard hospital setup sterile field tray. Seldinger Technique materials. The chest tube itself in a 32 French gauge that was appropriate for a trauma pneumothorax. Flutter valve, suture materials, a drainage collection unit. Nora opened it on the procedure cart and worked through the setup the way she'd been trained to work through it, in field conditions methodically, without rushing, because rushing a chest tube setup cost more time than doing it correctly the first time. Priya appeared at her elbow. "What do you need?" "Hold sterile field and monitor his pressure continuously. Call it out every 30 seconds. "Got it." Nora, irrigated, draped, identified the 5th intercostal space at the mid-axillary line by palpation and landmark. Reyes was unconscious, which meant no local anesthetic negotiation, which simplified one step. She made the incision. Blunt dissected through the intercostal muscle, perforated the pleura with controlled pressure, and felt the rush of air that confirmed the diagnosis. The tension had been real, and it was releasing now, and Reyes's oxygenation monitor, which had been sitting at 84% and declining, began to move. 86. 88. The tube went in. She connected the drainage unit. 91. "Pressure," she said. 88/60, Priya said. "Up from 74, okay." Nora secured the tube, dressed the site, and stood back for a single second to assess the full picture chest, rising symmetrically now. Color beginning to improve at the lips, the monitor tracking upward, not out of danger. Stabilized enough to survive the next step. He needs imaging and a thoracic surgical consult. I need someone to call it in. Graham was already on the phone. Nora stepped back from the bay and looked at the room. 4 patients, all of them alive, all of them in some stage of active management. The noise in the department had shifted again, not quieter, but different. Less acute, more sustained. The floor was holding. Pulled the gloves off and stood at the edge of the bay for a moment. Her hands were steady. She noticed that she was slightly short of breath, which was its own kind of information. She had been moving at maximum intensity for 26 minutes, and her body was accounting for it. That was when she became aware of Drace. He was standing at the entrance to the trauma bay. Not in it at the entrance, arms at his sides, and his expression was the one she had not seen on him before. Not the controlled authority, not the rehearsed neutrality. Something that was close to what happened when a person who had made a very specific calculation, discovered that the variables in their calculation were not what they thought they were. He had watched. She understood that now. He had stood at the edge of this room for some portion of the last 26 minutes and watched her work, and whatever he had expected to find whatever version of the performance of competence he had been prepared to dismiss, he had not found it. What he had found was the thing that couldn't be performed. The thing that either existed in a person or didn't, that no amount of institutional credential or careful nursing school training produced on its own, and that he had spent 6 weeks trying to explain away. She did not acknowledge him. She turned to Priya. "Krause's sedation level needs to be checked in 10 minutes. Set a timer." Already set, Priya said. Nora nodded and moved to help Gareth with the sergeant's vascular assessment, because the work was not done and standing at the edge of it was not her way of being in a room. Dryce left the bay entrance. She didn't watch him go. Major Lennox had come onto the floor at some point during the response. Nora wasn't sure when. She became aware of the officer standing near the central station in the particular way that someone with military bearing stands in a civilian space, not conspicuous, not intrusive, just present with a kind of quiet authority that the space accommodated. Lennox was watching the floor. Watching Nora specifically, Nora suspected, though she wasn't turning around to confirm it. Farrow was with her. He had his hands clasped behind his back, and his expression was the one Nora associated with people who had just seen something they were going to be thinking about for a while. At minute 34, Dr. Wills declared Specialist Krause stable post-intubation and ordered transfer to the ICU. At minute 38, the vascular surgeon arrived for the sergeant, and Crenshaw handed off with a briefing that was clean and complete. At minute 41, the TBI patient went to imaging under escort. At minute 47, the thoracic surgeon on call appeared for Reyes, reviewed the chest tube placement, and said, without looking up from the monitor, "Good tube position." He said it to the room, not to anyone specifically, which was the way surgeons often said things they considered self-evident. Nora knew it was her tube. She also knew it didn't matter who knew. She was writing notes at the central station when Darlene came to stand beside her. Darlene didn't say anything for a moment. Then all four are alive. Yes. Reyes would have been dead in another 3 minutes without the chest tube. Nora kept writing. The field medic did good work at the scene. Bought enough time. Nora. Darlene's voice had a quality in it that wasn't quite steady. You just ran a chest tube procedure without a physician present because there was no physician available and a man was dying. On a restricted rotation. In a department where the supervisor has been building a paper trail to remove you. A pause. That's either going to end your career here or define it. Nora looked up from the notes. It's going to save his life, she said. The rest of it gets sorted out later. She went back to writing. The sorting out started faster than later. At 5:17 p.m., Dr. Sonia Okafor walked on the emergency floor for the first time that Nora could remember seeing the director in the clinical space rather than the administrative wing. She was accompanied by a man Nora didn't recognize, 50s, civilian clothes, with the identifying lanyard of a federal contractor that Nora's eye caught and processed without making anything of it yet. Okafor went directly to Wills and spoke with her for several minutes. Then she went to Darlene. Then she asked Darlene something that made Darlene point toward the central station where Nora was finishing her documentation. Came to her, Ms. Vega, I'm Sonia Okafor. I don't know that we've met directly. We haven't, Nora said. I understand you were instrumental in the response this afternoon. Okafor was measuring her words, but not in the way Dryce measured his not to build something, just to be accurate. 4 military patients, one requiring an emergent thoracic intervention. The team handled it well, Nora said. Priya, Graham, Gareth, they all worked hard. They did, Okafor said. I've spoken with Dr. Wills. She's been clear about who made the call on Reyes. A pause. I've also been informed that you were on a restricted assignment at the time. Nora met her gaze. I was, and you acted anyway. There was a patient dying, and the bay was short a physician who could intervene. Acted in accordance with the medical emergency exception to scope restrictions, which is in the Facility Policy Manual, Section 7, Paragraph 4. She kept her voice neutral. That decision needs to be reviewed. I welcome the review. Okafor looked at her for a long moment. That's a very composed answer. It's the accurate one. Yes, Okafor said quietly. It is. She glanced at the man who had come in with her, who was standing far enough away to be politely out of earshot, but close enough to observe. I'd like you to come to my office tomorrow morning. 8 o'clock. There are some things I need to discuss with you, and some people I'd like you to meet. I'll be there, Nora said. Okafor nodded and moved away. The man with the federal lanyard watched Nora for a moment before following, and she got a better look at the lanyard. Then the agency identifier was partially turned, but she caught enough of it to place it. Inspector General's office. Department of Defense. She turned back to her documentation and finished it. Then she gathered her things, changed out of her scrubs, and walked to the parking lot. The Montana sky at 6:30 in the evening in late November was a dark that had wet to it, the kind of dark that came from elevation and cold, and the particular clarity of air that didn't have enough pollution in it to soften anything. Peaks she could see on clear mornings had disappeared into cloud. Sat in her truck without starting it. She had signed Lennox's form. She had run the chest tube. She had given her account of the past 6 weeks to a federal officer, and the hospital director now knew the IG's office was involved. And tomorrow at 8 o'clock, there was going to be a conversation that was going to be very different from any conversation Harlow Veterans Medical Center had offered her since she arrived. She was aware that something had turned, not resolved turned slowly, with the whole weight of it coming around, and you feel the new heading before you see what's in front of you. Started the truck. She drove home. She ate something without tasting it, went to bed earlier than usual, and lay in the dark thinking about Reyes's oxygen saturation climbing on the monitor 84, 86, 88, 91, the numbers moving in the right direction, each one a small confirmation that something she had done had worked, that someone was still breathing who might not have been. That was the part that stayed with her. That was always the part that stayed. She was back at Harlow at 7:43 the next morning, which gave her 17 minutes before Okafor's meeting. She used 14 of them to check on the patients from the previous day. Krause in the ICU, stable and extubated. The sergeant in post-surgical recovery with vascular repair complete. The TBI corporal in neurology observation. Reyes in the thoracic surgery ward with 2 chest drains and a blood pressure that had normalized overnight. Stood outside Reyes's room for a moment without going in. Through the glass panel in the door, she could see him awake, which she hadn't expected, lying at a slight incline with the drain tubes visible against the hospital gown and the particular exhausted vacancy on his face. That was what a person looked like when they'd been very close to something and had come back from it, but hadn't had time to understand what they'd come back from. She was about to turn toward the administrative wing when his eyes moved. He was looking at the door. He was looking at her. She pushed it open slightly. Staff Sergeant Reyes. I'm Nora Vega. I worked your case yesterday. His voice was rough and quiet. Chest tube. Yes. He looked at her for a moment. He had the kind of face that had been handsome before it got complicated by years and deployment, and the eyes in it were very clear and very direct. They told me this morning, he said. What happened? She waited. I wasn't going to make it, he said. It was a statement, not a question. Not looking for reassurance. Just confirming a fact so he could put it in its right place. The field medic bought time, she said. You had people working for you. He was quiet for a moment. Are you military? She met his eyes. I was. He nodded, a single small movement. Yeah, he said. Tell. And then, because he was clearly in significant pain and very tired, and not a man who spent words he didn't need to spend, he closed his eyes and was done. Pulled the door quietly closed and walked toward Okafor's office. She was outside it at 8:01 when she heard voices through the closed door that she hadn't expected. She recognized Lennox. She recognized Okafor. She recognized the measured cadence of the man with the IG lanyard. And then there was a fourth voice. She did not immediately place a man's voice, older, with a formality in it that wasn't bureaucratic. It was something else. Something that had the particular weight of institutional authority that came from very high up. Okafor's assistant opened the door before Nora knocked. The room was larger than it looked from the hallway. Okafor was at her desk. Lennox was to the left, standing. The IG officer was in a chair by the window, and at the far end of the room, standing in front of the wall where Okafor's credentials hung, was a man in army dress uniform with the rank of brigadier general. Nora stopped. He looked at her with the expression of someone who had spent the last several hours reviewing a file and had been waiting to see whether the person in the file matched the person in the room. Ms. Vega, he said. I'm Brigadier General Arthur Mace. Commanded the 43rd Special Operations Medical Group during your last deployment. A pause. You saved 11 soldiers in my unit. Another pause, shorter, including my son. The room was entirely silent. Nora stood in the doorway and did not move. Sit down, Okafor said gently, and Nora realized distantly that she had not blinked in several seconds. She came into the room. She sat down. Lennox set a folder on the desk in front of her. Nora looked at it without opening it. Then she looked at Mace, and he was still watching her with that expression that was doing more than one thing at once. General, she said, with the particular steadiness of someone calling on every trained instinct they had to keep their voice even. I don't understand why you're here. Yes, you do, Mace said. You signed the form last night. You ran that chest tube. You've been at this facility for 6 weeks, and you've been systematically documented, restricted, and targeted for removal by an administrator who is afraid of what you represent." He came forward. He placed a second document on the desk, different from Lennox's, different letterhead, a seal she knew. "We're not here because of Drace. We're here because of what's behind him." Nora looked at the document. The letterhead read, "Department of Defense, Office of the Inspector General, Formal Investigation, Harlow Veterans Medical Center, Patient Care Fraud and Administrative Misconduct." Her name was not in the title, but 3 lines down, under the heading of Key Witnesses, it was the first name on the list. She looked up at Mace. "How long has this been open?" 14 months, he said. "We've been waiting for someone inside the facility with enough documented exposure to Drace's conduct to serve as a credible witness." He looked at her steadily. "We didn't know you were here until Drace made that inquiry into your background, and your name hit our cross-reference." Air in the room had a quality she associated with the moment before something that had been building for a long time finally arrived. She had stood in rooms like this before, different rooms, different stakes, the same feeling of weight resolving into form. She looked at the investigation document. She looked at the list of patient cases, below her name 14 of them, spanning 3 years, all current or former military personnel who had received substandard care at Harlow under circumstances that the IG office believed were connected to administrative decisions Drace had made to protect his own record. 14 patients. Some of them had outcomes she was only reading about now. One of them had died. She looked up. Her voice was even. "What do you need from me?" Mace exchanged a look with the IG officer. Then he looked back at Nora. "Everything," he said. "Your testimony. Your direct account of the last 6 weeks. And something else." He paused. "We need you to keep working here. Same floor. Same access. For as long as the investigation requires your presence on site." Nora understood immediately. "You want me in the facility while you build the case. We want you where you can see what's happening and where the patients can continue to have someone paying attention." He said it without apology. "We know what we're asking." Nora sat for a moment. She thought about Reyes's oxygen saturation on the monitor. She thought about Tate's arm and 3 weeks of a torn labrum. Thought about Mrs. Albright. She thought about the 14 names on the list and the one who had not survived. Picked up the pen on Okafor's desk. She looked at Mace. "I need something from you first," she said. "The staffing. The floor is running 2 nurses short every shift. That's not an investigation problem. That's a patient safety problem. It needs to be fixed regardless of anything else." Mace looked at Okafor. Okafor said, "I can have 2 agency nurses on floor by Monday." "Then yes," Nora said, and signed. She set the pen down and looked at the room. 6 people, all watching her, and she was aware of the specific quality of attention in it, the way you are aware of being looked at by people who have just confirmed something they were not entirely sure of until this moment. She didn't perform anything for it. She just looked back. "One more thing," Lennox said. She opened her folder and pulled out the second document, the one she'd placed on the table in the consultation room the night before, the one Nora had not touched. She set it in front of her again. "This still needs your signature. Separate from the investigation. It belongs to you, regardless. Commendation document. The one that had been waiting 2 years in a processing backlog because the unit closed and the reviewing officer transferred, and the paperwork sat in an administrative limbo that nobody had been in a hurry to resolve until Nora Vega's name showed up on a cross-reference query initiated by the man who had been trying to remove her." She looked at it for a long moment. Then she signed it, too. She capped the pen and stood. Mace was watching her with an expression that was not sentiment. It was something more complicated than that. Something that had grief and relief in it, and the particular weight of a man who had carried the name of someone who had saved his son's life for long enough that finally being in the same room with her was its own kind of thing to manage. "Ms. Vega." She looked at him. "Thank you," he said. "Just that." She nodded once and turned toward the door. She had her hand on the frame when her pager went off, not her department pager, but the general emergency alert that activated on every device in the facility when something exceeded normal protocol. She looked at the code on the screen. Mass casualty alert. Secondary wave. 4 additional military transport vehicles from the same training exercise. 7 patients. ETA 6 minutes. Behind her, she heard Lennox say something sharp to Farrow. She heard Okafor pick up her desk phone. She heard the general's voice ask a question and the IG officer's voice answer it. She was already in the hallway, moving toward the trauma bay, when she heard Drace's voice coming from the direction of the administrative wing, louder than she had ever heard him. Not composed now, not managed. Something had broken through the performance, and what was underneath it was not what the performance had promised. She did not stop. She turned the corner and ran. Behind her, in Okafor's office, Brigadier General Arthur Mace watched the doorway where Nora Vega had been standing and said, to no one in particular, there it is. The second wave hit Harlow like weather. Nora heard the bay doors open before she reached the corner, heard the Army medics calling out patient conditions in the compressed shorthand of people who had been managing catastrophe for the last 40 minutes and were running on the particular fuel that kicked in. When the body understood, there was no alternative. Came through the trauma bay entrance, and Darlene was already there, standing at the center of a floor that was reorganizing itself in real time, a floor that 24 hours ago had been managing routine caseloads and was now receiving its 11th military casualty in 2 days. What do we have? Nora said. Darlene handed her a relay sheet. 7 inbound, 3 priority 1. 1 pediatric soldier's dependent, civilian vehicle caught in the convoy perimeter. 2 with polytrauma, 1 with a cervical injury, they're not sure is stable. 1 with a burn component from the secondary vehicle fire, 2 walking wounded. She looked up. Surgical is already being paged. The pediatric is 6 years old. Nora took the sheet. She read it in 4 seconds. Who's on? Wills is here. Crenshaw just came back in, I called doctor. O.C. Forson from home, he's 20 minutes out. Pediatric attending is being patched in remotely until doctor. Marburg gets here from the children's annex. Marburg is 15 minutes minimum, Nora said. The 6-year-old comes to me until she's here. Darlene did not argue. She had stopped arguing with Nora about clinical instincts approximately 2 weeks ago. First 3 transports came through in a 90-second sequence. Nora took the pediatric patient, a girl named, according to the transport medic, Lily, though the medic said it with the careful uncertainty of someone who had gotten the name from the scene and wasn't certain 6 years old. Blunt abdominal trauma from a seatbelt in a low-speed collision with a military vehicle that had swerved to avoid a rollover. She was conscious. She was not screaming, which was both better and worse than screaming, because children who stopped making noise after trauma sometimes did so for reasons that required immediate attention. Nora crouched to the child's level the moment the stretcher was wheeled in. Hey, I'm Nora. What's your name? The girl looked at her. Her face was pale, and she was holding her stomach with both hands in the reflexive way of someone protecting something that hurt. Lily, she said. Lily. That's a good name. Nora put one hand gently on her shoulder, kept her voice even and low. Tummy hurt? Yeah. Okay. I'm going to push very gently in a few places, and I need you to tell me which ones hurt the most. Can you do that? Lily looked at her for a second. Where's my dad? Your dad is being helped by other doctors right now. He sent you to me. The child's father was the soldier in the cervical injury transport. Nora had seen the name on the relay sheet. He's okay, and you're okay, and we're going to take good care of both of you. It was not a perfect answer. It was the available true answer, which was different, and the girl seemed to process the difference, but accept it, which was the most Nora could offer her right now. She performed the abdominal assessment with Priya assisting on the monitor leads. Liver tenderness on palpation, right upper quadrant, moderate. Bowl sounds present. No guarding rigidity that suggested perforation, but the tenderness was real and localized in a way that needed imaging. She ordered the ultrasound fast exam, focused assessment, and while she waited for it, she held the child's hand and kept her talking about nothing in particular, about what grade she was in, about what her dog's name was, because a conscious, frightened child who was talking was a conscious, frightened child whose airway and neurological status could be assessed in real time without a single additional procedure. The dog's name was Pancake. Nora smiled at that. It was a real smile, not a clinical one. Lily noticed the difference. The fast exam showed free fluid in Morrison's pouch, a small amount, not the explosive hemorrhage pattern that would have sent them to surgery in minutes, but enough to require monitoring and a CT confirmation. Dr. Marburg arrived 11 minutes later, reviewed the findings, and took over the case with the particular focused competence of a pediatric attending who had been called in on short notice and arrived already running. She looked at Nora's assessment notes, looked at the fast results, looked at the child. Good catch on the fluid, Marburg said. She's stable, Nora said. Father is the cervical injury in Bay 7. She's been asking. Marburg looked at her. Then she looked at Lily and said, "We're going to get you some pictures taken of your tummy, and then we're going to see about getting you closer to your dad." She said it with the specific calibrated confidence of someone who had spent years learning how to tell children true things in ways that didn't also terrify them. Nora left Lily with Marburg and moved to the polytrauma bays. The next 90 minutes were the hardest sustained stretch of the 2-day response. Not because any single patient was beyond what the floor could handle, but because the accumulated weight of managing 7 new patients on top of the 4 from the previous day patients, who were still in various stages of post-acute care and still required monitoring and intervention, meant that every person on the floor was operating at a level of concentrations that had a ceiling, and that ceiling was getting closer. Nora felt it in herself. Not failure, not even near failure, but the place beyond a second wind where the body was running on something that wasn't quite a third wind. More like a kind of grim metabolic stubbornness that had been trained into her in environments where stopping wasn't available as an option. She kept moving. She triaged, assessed, intervened, handed off, looped back. She caught a blood pressure drop on the burn patient that 2 other nurses had not yet noticed and called it before it became a crisis. She assisted with the cervical stabilization on Lily's father, a sergeant named Torres, whose injury turned out to be ligamentous rather than bony, still serious. Still requiring a hard collar and neurosurgery consult, but not the catastrophic cord injury that the initial transports assessment had feared. She told him his daughter was stable. He closed his eyes for a moment, just one moment, and then opened them and said, "Thank you." 2 words, and the weight in them was not the weight of polite gratitude. It was 4:20 in the afternoon by the time the floor began to find its new equilibrium, not quiet, not resolved, but past the acute peak. Every patient accounted for, every active track covered. Stood at the central station and wrote notes until her hand ached slightly. Then kept writing, because the notes were how the next shift would know what had happened, and the next shift mattered as much as this one. She was on the last notation when the sound from the administrative corridor reached the floor. She heard it before she identified it: raised voices, not patient voices, not the compressed urgency of clinical communication, but something more fractured. She looked up. Darlene was looking toward the corridor entrance. Priya had stopped moving. The voice that resolved out of the noise was Drace's, and it was doing something she had not heard it do in 6 weeks of working beside him. It was not controlled. It was not measured. It was the voice of a man who had walked into a room expecting a negotiation and found something else entirely, and was now doing what people do when the ground shifts beneath a structure they believed was solid, making noise, as if noise could stabilize it. Couldn't hear words yet. She could hear the pattern. She had heard patterns like that before. She went back to her notation and finished it. 2 minutes later, the IG officer whose name she had learned in Okafor's office was Special Agent Darren Holst walked onto the floor with a second agent she didn't recognize. They were both in civilians. They were civilian clothes, both with federal identification visible at the collar, and they walked with the deliberate, unhurried pace of people who knew exactly where they were going and did not need to announce it. They went to the central station. Holst looked at Darlene. "We need Dreise's office secured and the department's patient records for the last 36 months held pending review. We have authorization from facility administration." He placed a document on the counter. Darlene looked at it. "Dr. Okafor has been notified and has provided key access. We'll need someone from clinical staff to walk us through the records system." Darlene looked at Holst, then at the document. Then she straightened. "Can do that," she said. Holst nodded. "We'll also need a statement from you regarding the staffing log notation you made 8 days ago." Darlene said, "I have a copy of it in my files." "Good." He looked at the floor, at the bays, at the organized aftermath of 11 patients in 2 days, and the staff moving through it. Then he looked at Nora, who had turned from the chart station and was watching him without expression. "Ms. Vega, we'll need your formal testimony today if possible, given the timeline we're working against." "I know," she said. "Give me 20 minutes to finish handoff notes for the incoming shift." He nodded and moved toward the administrative corridor with his colleague. Darlene watched them go, then looked at Nora. "It's happening," Darlene said. Question: "Yes." Darlene was quiet for a moment. She picked up the IG authorization document from the counter and read it through once carefully, the way she read everything. Then she set it down. "He destroyed 2 nurses before you," she said. Marta Osei, no relation, and a travel nurse named Pryor. Both of them filed grievances. Both of them were out of this department within 90 days. Healthcare entirely. She paused. I testified for Marta. They said there wasn't enough documentation. There's documentation now, Nora said. There's documentation, Darlene agreed. Her voice had a quality in it that was not quite satisfaction. It was older than satisfaction, and heavier. Nora finished her notes. She spent the next 3 hours in a conference room with Holst and the second agent, whose name was Reeves, giving a recorded testimonial account of every interaction with Drace since her first shift at Harlow, the initial assessment in his office, the supervised rotation, the reassigned schedule, scope violation notation, the recommendation for transfer, every specific date and every specific exchange she could recall, with the precision of someone who had been trained to observe and retain information in environments where accurate recall was not an administrative nicety, but a survival requirement. She did not editorialize. She did not perform outrage. She stated what happened, when it happened, what was said, and what the documented outcomes were, and she answered every follow-up question with the same flat accuracy. Holst, who had conducted enough testimonial interviews to know the difference between rehearsed and genuine, made a note in the margin of his recording log that he did not read aloud. At 7:48 in the evening, Dr. Okafor formally suspended Drace from clinical duties pending the investigation. The suspension was delivered in writing, hand-carried by Okafor's assistant to the office, where Drace had been since mid-afternoon, not his office, which was now secured, but a borrowed administrative space that the hospital had made available while the process unfolded. The assistant reported back to Okafor that Drace had read the document, placed it on the desk, and said nothing. The nothing was significant. Drace's particular brand of authority had always been verbal, the crafted sentence, the reasonable-sounding frame, the language that made his decisions look like institutional care rather than personal control. Without access to the institutional levers that gave that language its weight, it seemed that the language itself had gone somewhere private. Okafor noted it and did not read too much into it, because she had seen enough of these situations to know that people in Drace's position often went quiet right before they found a lawyer and got loud again through a different channel. She was right about the lawyer. He arrived the following morning, a man named Kettrick, from a firm in Billings that handled physician licensing disputes, with the particular polished certainty of someone who had walked into rooms like this many times and was accustomed to the other side flinching. He reviewed the suspension document. He reviewed the IG authorization. He spoke with Drace in the borrowed administrative space for 45 minutes with the door closed. When the door opened, Kettrick went to speak with Holst. Nora was on her morning shift when this happened. She was aware of it in the background. The hospital was not a large enough space for these things to happen entirely invisibly, but it was in the background, and the foreground was work. She was on full trauma rotation, the restriction having been formally lifted by Okafor's written order the day before, and the emergency floor was quieter than it had been in 48 hours, which gave it a deceptive calm that she recognized and did not trust. Staff Sergeant Reyes had been moved from thoracic surgical to a standard recovery room on the 3rd floor. Nora stopped by at 8:15 before the floor got busy. He was sitting up when she came in, not fully upright. The drains were still in place, and the pain was visible in the set of his face, but sitting up enough to look at the window rather than the ceiling, which was its own kind of progress. "How's the breathing?" she asked. "Hurts," he said. "That's actually a good sign at this point. Means the lungs working." He looked at her. He had the same directness as the day before, but there was something different in it. Now, less the flatness of someone who has just come back from the edge, more the alertness of someone who had slept and eaten and started processing. "I heard what happened," he said, "on the floor. Both days." "Word travels," she said. "The guys talk." He meant the other patients, the soldiers from the convoy, some of whom were in rooms near each other and had already established the informal communication network that service members assembled in any shared space by instinct. They said, "You ran the chest tube." "I did," and that the hospital had you on some kind of restricted duty. She looked at him. "That's being resolved." He was quiet for a moment. He looked at the window. "You know what bothers me," he said. Not asking thinking aloud in the way of someone who has decided the other person in the room can handle honest thinking. "I've been in environments where the most qualified person in the room gets sidelined because somebody above them is threatened by it. Usually goes bad for the mission. He looked back at her. Always wondered if that happened outside the service, too. It does, she said. Yeah. He exhaled carefully, managing the depth of it around the drains. Glad you didn't stand down. She didn't answer that. She checked his drain output within normal range and updated his chart and told him the thoracic surgeon would be in by 10 and that the drain removal might be possible in the next 24 to 48 hours if his numbers held. She left him looking at the window again. Downstairs, the Kettrick situation had developed. Holst came to find Nora at 11:30 with an expression that was professionally neutral and personally satisfied in a way he was managing but not entirely succeeding at. Dryce's legal counsel has indicated that his client is willing to cooperate with the investigation in exchange for a negotiated resolution regarding his licensing, Holst said. Nora looked at him. He's going to give them something. He's been supplementing his administrative income through a billing arrangement with a private medical contractor that supplies equipment to this facility, Holst said. He approved procurement orders for equipment he assessed as necessary. The contractor billed at inflated rates, and Drace received a percentage of the margin. He paused. The arrangement has been running for 4 years. The contractor is also under federal review. Nora processed that. The equipment approvals he made, did any of them affect patient care? Holst looked at her steadily. Some of the approved equipment replaced functioning units that were downgraded to create the need. In 2 documented cases, the downgrading caused delays in diagnostic imaging that affected patient outcomes. He let that sit for a moment. One of those patients died. He was a veteran, 71 years old. Name was Arthur Wren. Arthur Wren. One of the 14 names on the investigation list. The one at the bottom with a date that was 14 months ago. Nora stood very still. That's why the investigation opened, she said. Why the investigation opened, Holst confirmed. We couldn't get enough from the inside. The staff who knew something were either gone or too exposed to speak without protection. He paused. You gave us everything we needed. Your 6 weeks of documented interaction with Dryce, combined with the staffing log, the patient outcomes, and the billing records the IG's financial unit had already compiled, it's complete. She looked at the floor for a moment. She thought about Arthur Wren, 71 years old, a veteran, and the imaging delay that had cost him the window in which treatment might have worked. She thought about Drace signing procurement orders and the contractor running the margin and nobody at Harlow looking at the intersection of those 2 things until a person who was difficult to sideline showed up and stayed. What happens to him, she said. License revocation proceeding, federal charge for fraudulent billing, and the contractor case carries additional counts. Holst was precise about it. It won't be fast. It won't be clean. But it will be on record, and the licensing board has already been notified. He will not practice medicine in a supervisory capacity at a federal facility again. Nora nodded. It was not satisfaction exactly. It was the feeling of a weight that had been distributed incorrectly, being redistributed correctly. Not pleasant, not triumphant, just accurate. There's a hearing next week, Holst said. Administrative level at the facility. Your testimony will be read into the record. You don't have to be present, but I'll be there, she said. He nodded. He started to move away, then stopped. Ms. Vega. For what it's worth, your instinct to stay, to not file the grievance and walk away, to trust that the overreach would come. He paused, like a man choosing his words carefully in a way that was unusual for him. It made the difference. She looked at him. Arthur Wren made the difference, she said. Got here late. Holst held her gaze for a moment. Then he walked back toward the administrative wing. The administrative hearing was set for the following Tuesday. In the 6 days between Holst's conversation with Nora and the hearing, the hospital operated in the particular suspended state of an institution that knew something large was coming and had not yet experienced its arrival. Dryce's clinic remained suspended. A senior attending from the regional health authority had been brought in to cover the department while the credentialing office worked through the implications of the investigation. The IG agents were a visible presence in the administrative wing. Okafor walked the floor each morning with a deliberateness that communicated she was aware of every part of what was happening and was not managing it from behind a closed door. On the 3rd day of that interval, something happened that Nora had not expected. She was at the central station at the end of her shift, 4:50 in the afternoon, the incoming shift doing their handoff when Lieutenant Farrow came onto the floor. He was in working fatigues this time, not service dress, and he had Kodak on the military lead. He looked around the floor until he found Nora, and then he walked toward her with the directness of someone who had decided something and was carrying it out before he reconsidered. Kodak reached her first. The dog's behavior was exactly what it had been the first time, the same unhurried certainty, the same settling at her feet, the same tail movement that was slow and deliberate rather than eager. Nora crouched and put her hand on his side. Pharaoh stopped in front of her. "I wanted to bring him back," he said. I thought he paused and she could see him working through whether what he had to say was going to come out the way he meant it. "I thought you might want to see him." Now that he gestured vaguely at the facility around them, at the changed air of it. Now that things are different. Nora looked at Kodak. The dog was looking at her with the particular attention of an animal that had decided, on some operational basis she would never fully understand, that she was the relevant person in any room she occupied. "How's he doing?" she said generally. "Good days and bad days," Pharaoh said honestly. "The transition has been, he doesn't always know what to do with himself. Out of deployment, no mission structure. Some days he's fine. Some days he paces." "That sounds right," Nora said. "Not clinically, just accurately." Yeah, Pharaoh was quiet for a moment. "General Mace's office reached out to me yesterday about a program. Veteran and canine rehabilitation, co-located with a medical facility." He looked at her. Someone apparently recommended that Harlow could be a site for it. Nora looked up at him. "The recommendation came from the Surgeon General's office," Pharaoh said. "It had your name on it." He said it not as an accusation, and not as a compliment, just as information, placed in front of her the way someone places a fact they want to make sure gets heard. She looked back at Kodak. The dog's breathing was slow, and even and entirely comfortable, the breathing of an animal that had no reason to be on alert, which was not how he usually breathed in unfamiliar spaces. "He needs structure," she said. "Something that isn't combat and isn't nothing." "Yeah," Pharaoh said. "That's pretty much what the recommendation said." She stood. Kodak stood with her, settling to her left side the way he'd done before, a position that was not trained to her, it was chosen, which was different, and she understood the difference. "Tell General Mace's office I'm interested in the conversation," she said, after the hearing. "I will," Pharaoh said. She said goodbye to Kodak in the quiet, matter-of-fact way that was the right way to say goodbye to a working dog, not dramatic, just clear, and Pharaoh walked him back toward the entrance. She watched them go. The hearing convened at 9 in the morning on Tuesday in the facility's main conference room, which had been reconfigured to accommodate a formal administrative panel, 2 officials from the Regional Health Authority, one from the Army Medical Command Liaison Office, Holst from the IG, and Okafor representing facility administration. Drace was present with Ketrick. 2 representatives from the State Medical Licensing Board attended as observers. Nora sat on the testimony side of the table, with her hands flat in front of her. She had not brought notes. She did not need them. The proceedings ran 4 hours. Holst presented the billing documentation. The financial unit from the IG presented the contractor relationship evidence. The licensing board representatives reviewed the clinical negligence findings tied to the equipment procurement delays. Darlene's staffing log was entered into the record. Graham's supervision report was entered. The patient satisfaction data was entered. The outcomes for the 14 patients on the investigation list were reviewed one by one, with the clinical documentation for each case laid against the administrative decisions that had surrounded them. Arthur Wren's case was presented last. The room was quiet when it was read. Drace sat through all of it. His posture was correct. His expression was controlled. Ketrick made objections at specific points, each of which was acknowledged and noted, and not sufficient to alter the documentary record, because the documentary record had been built over 14 months by people who knew what they were building and had been waiting for the piece that completed it. Nora gave her testimony in the second hour. She spoke for 40 minutes. She was not asked to characterize Drace's motivations. She was asked only to describe what had occurred, and she described it with the specific, unrehearsed accuracy that she had given to Holst in the conference room 3 days earlier, and the panel listened without interrupting. When she finished, the health authority official, a woman named Dr. Sables, who had been taking notes throughout, looked at her for a moment and then said, "Ms. Vega, on behalf of the regional panel, I want to acknowledge that your decision to remain in this facility and document your experience in real time, rather than filing a grievance and leaving, was not the path of least resistance. We understand that." Nora looked at her. 11 military patients came through this emergency department in 2 days, she said. Least resistance wasn't the point. Sable held her gaze for a moment. Then she made a note. At 1:43 in the afternoon, the panel chair read the preliminary findings. Dryce's medical privileges at Harlow Veterans Medical Center were immediately and permanently revoked. The fraudulent billing matter was referred to federal prosecution. The licensing board would open a formal revocation hearing within 30 days. Facility would undergo a complete administrative review, and Okafor was formally directed to implement staffing and oversight reforms within 90 days. Kettrick leaned in and said something to Dryce. Dryce did not respond. He looked at the table in front of him, and the expression on his face was not defiance and not remorse. It was the expression of a man who had been certain of his position for long enough that the loss of it had not, yet resolved into anything his face knew how to show. Nora watched him for exactly 1 second. Then she looked away. Outside the conference room, she walked to the far end of the administrative corridor, where a window looked out over the hospital's east parking lot and the beginning of the foothills beyond. Sky was clear for the first time in a week, the peaks visible again, sharp-edged against a blue that was pale and cold and unambiguous. She heard footsteps behind her and turned. It was Okafor. The director stood beside her and looked out the window for a moment without speaking. Then she said, "I owe you a direct apology. Not a formal one, I already did that part. A direct one." She paused. "I knew something was wrong in this department before you arrived. The pattern was there. I was too slow." Nora looked at her. "You asked before you acted on Dryce's removal recommendation," she said. "That mattered. It was late. It was before the harm. That's something." Okafor was quiet for a moment. "What do you need?" she said. "Facility. Going forward." Nora looked back at the window. The foothills had the look of late autumn, the color mostly gone, the structures of things more visible. She thought about what Pharaoh had said about Kodak. Good days and bad days. She thought about Lily asking where her dad was. Thought about Reyes's oxygen saturation on the monitor, and Tate's 3 weeks, and Wren's name at the bottom of the list. 2 agency nurses, she said. Make them permanent hires. The floor needs consistent staffing, not rotating coverage. Done, Okafor said. And the canine rehabilitation program. Mesa's office is moving on it. I want this facility to be a serious candidate, not ceremonial operational, with real resources and real space. I'll make the case to the board myself, Okafor said. Nora nodded. She kept looking at the window. She was tired in a way that had nothing to do with the hours she'd worked, a different kind of tired, the kind that came from carrying something for a long time and not having a place to set it down. She was aware that the place might be closer now than it had been before. She wasn't sure yet. There's one more thing, Okafor said. Her voice had shifted slightly. Nora turned. The director was holding a folder. She held it out, and Nora took it. Inside was a single printed document, not the commendation form, that was already signed. Something else. A formal letter of recommendation, on Harlow Veterans Medical Center letterhead, co-signed by Okafor and by Dr. Sable from the Regional Health Authority, and by the name at the bottom that Nora saw last and read twice, Brigadier General Arthur Mace. The letter was addressed to the Army Medical Corps Civilian Excellence Award Board. It described her service at Harlow. It described the chest tubes and the pediatric assessment and the Tate flag and the testimony. It described, in the careful language of official documentation, what she had done and why it had mattered and who had been served by it. And at the bottom, below Mace's signature, in handwriting rather than print, were 4 words that were not standard letter language. She read them. She did not say them aloud. She closed the folder. She looked at Okafor. She looked at the window. She looked at the foothills and the clear cold sky above them and the peaks that had been invisible for a week and were now exactly where they had always been. Then her pager went off. She looked at it. It was not an emergency code. It was an internal page from the ICU specialist Krause is attending, requesting a nursing consult on a post-intubation assessment. Routine. Necessary. The work that was always there. She folded the letter back into the folder, tucked it under her arm, and walked toward the elevator. Behind her, Okafor stood at the window alone. She looked at the peaks and then down at the parking lot where, visible from the 3rd floor, Lieutenant Pharaoh was walking Kodak on the military lead along the edge of the lot. The dog was moving with the unhurried alertness of a working animal in a familiar space, not anxious, not subdued, just present, watching. Okafor watched them for a moment. Then she went back to work too. Upstairs in the ICU, Nora was standing at Krause's bedside, reviewing his post-extubation respiratory data, when the specialist awake, young, not yet 23, with a face that looked like it was still deciding what it wanted to look like, opened his eyes and said, without preamble, "Did they tell you what happened to the guys from my convoy?" "Most of them," she said. "Everyone's alive." He looked at the ceiling for a moment. Then he said, "All of them?" "All of them," she said. He closed his eyes again, and the thing that moved through his face was not relief exactly. It was more complex than that, more private, but she recognized it from enough other faces in enough other rooms to know what it was and to give it the space it needed without filling the silence. She went back to his chart. She was finishing the notation when her phone buzzed with a message from an unfamiliar number, a federal area code she placed immediately. The message was 2 sentences. Formal investigation findings filed 3 p.m. today. Dreise's license suspension effective, immediately pending board hearing. She read it twice. She put the phone back in her pocket. She wrote the last line of the notation, dated it, and initialed it. Then, in the quiet of the ICU, with the monitors running their steady commentary, and Krause breathing on his own for the first time in 36 hours, she became aware that she could hear her own heartbeat, even, measured, present, and underneath the tiredness and the clarity, and the knowledge of everything that had been set in motion today, there was something else. Something that had not been there 6 weeks ago, when she drove into the Harlow parking lot in the truck with the cracked mirror, something that had no official name in any report or record or commendation letter, something that was simply the feeling of a person who had stood in the place they were supposed to stand and had not moved. She stood at Krause's bedside for another moment. Then she heard the elevator doors open down the hall, and voices, 2 of them, a woman and a man, familiar cadences, and she recognized the particular tone of a conversation that had the structure of a formal approach, not casual, not routine. Turned from the bedside, coming down the ICU corridor toward her were Major Lennox, and, beside her, a person Nora had not expected to see at Harlow, a civilian in a dark suit with a congressional staff identification badge at the lapel, walking with a slightly too deliberate pace of someone who had been briefed on where they were going and what they were going to say when they got there. Lennox saw her and stopped. "Ms. Vega." A pause. "There's something we need to discuss that wasn't in the hearing today." Nora looked at the congressional badge. She looked at Lennox. "What kind of something?" she said. Lennox glanced at the congressional staffer. Staffer looked at Nora with an expression that was careful and direct in equal measure. "Kind," he said. "That requires your presence in Washington next week." Nora looked at the congressional badge for another second, then at Lennox, and then she did something that caught both of them slightly off guard. She looked at the ICU room behind her, Krause's monitor still tracking his breathing in its steady green rhythm, and she said, "Give me 5 minutes." The staffer blinked. Lennox did not. Lennox had, by this point, developed a reasonable working understanding of how Nora Vega operated in spaces that expected her to drop everything and orient toward whoever had just walked in with authority, and the understanding was that she would finish what she was doing first. Nora updated the last line of Krause's nursing note, flagged it for the ICU attending, and checked that the overnight monitoring parameters were correctly set. Then she pulled the curtain to give him quiet and walked toward Lennox and the staffer. "Okay," she said, "Washington." Staffer's name was Elliot Marsh, and he worked for the Senate Armed Services Subcommittee on Military Medical Affairs, a body that had been reviewing a report on veterans' care standards at federal facilities for the past 11 months. The Harlow investigation, he explained, as they moved to a private consultation space off the ICU corridor, had intersected with that report at 3 specific points: the billing fraud, the patient outcome data, and the gap in whistleblower protection that had allowed Dreis to operate for 4 years without meaningful internal check. "The subcommittee chair wants to hear from people inside the system," Marsh said. "Not administrators, not contractors. People who were in the room when things went wrong and stayed long enough to see what that looked like." He looked at Nora directly. "Your name came from General Mace's office and from Special Agent Holst, independently. Doesn't happen often." "What would the testimony cover?" Nora said. "Your experience here, framed within the broader question of how facilities fail to protect patients and staff when supervisory power goes unchecked." He paused. "And what a functional system would look like. Based on your experience from both sides." Both sides. She understood what he meant. You want military medical perspective and civilian medical perspective. We want someone who has operated in both systems and can speak credibly about where the gaps are. He set a card on the table between them. The hearing is in 9 days. You'd be one of 4 witnesses. The testimony is voluntary, public record, and will be published in full as part of the subcommittee report. Nora looked at the card. She looked at Lennox. Is this connected to the IG investigation? Adjacent, Lennox said. Separate proceedings. The IG investigation closes here. This is about systemic reform, not Dryce specifically. She paused. Though Dryce is in the report as a case study. Nora sat with that. Case study. Callum Dryce, 4 years of billing fraud, 14 patients whose care was shaped by his decisions, Arthur Wren dead at 71, 2 nurses driven out of the profession, 6 weeks of documented, deliberate pressure applied to a new hire, he considered a threat reduced in a congressional document to a case study. That was the correct frame for the work the subcommittee was doing. She understood that. It was also strange, in the way that the translation of a specific human experience into institutional language was always strange, always a little bit like watching something real become a map of itself. I'll be there, she said. She picked up the card, stood, and shook Marsh's hand. He held the handshake a moment longer than a purely professional handshake required, which she suspected was his version of saying something he didn't have official language for. She walked them to the elevator and watched the doors close. Then she stood in the corridor for a moment, with the card in her hand and the folder with Mace's letter under her arm and the quiet of the ICU around her, and she breathed in and out twice, steadily, the way she had learned to breathe in, places where breath was the thing you could control when everything else was moving too fast. Then she went back to work. She had 40 minutes left in her shift, and there was a patient on the 2nd floor whose medication reconciliation she had promised to check before she left. The 9 days between Tuesday's hearing and the Washington trip were the quietest 9 days Nora had spent at Harlow. Not quiet, in a comfortable way, more like the quiet of an institution that was taking stock. Temporary attending, who had replaced Dryce, was a competent woman named Dr. Ferreira, who had managed emergency departments before, and who came in without ego and without territory, and simply ran the floor, which was both a relief and a kind of mirror. The floor ran fine, without the architecture of authority that Dryce had spent years constructing. It ran on the work, which was what it had always been running on, once you removed the interference. Darlene, who had been filing staffing reports and patient outcome tracking for years into a system that she suspected nobody was reading, had her data formally reviewed for the first time. The Regional Health Authority analyst who reviewed it spent 2 days going through it and came back with a written assessment that described Darlene's work as a model of longitudinal clinical documentation. Darlene read the assessment, folded it, put it in her desk drawer, and went back to the shift. But Nora had seen her face when she read it, and the thing in her face was the private satisfaction of someone who has done good work in the dark for a long time and has finally had someone turn a light on. Graham was asked to serve on a peer review committee for the facility's clinical standards board. He accepted without fanfare and showed up to the first meeting with a yellow legal pad and 3 years of observations that he had been keeping to himself, because there had been no structural mechanism for them to go anywhere useful. Priya got a formal letter of commendation for her work during the 2-day mass casualty response. She put it on the break room bulletin board, which embarrassed her, but Darlene had put it up while she was on shift, and she couldn't bring herself to take it down. Gareth, the traveling nurse, extended his contract. He told Darlene it was because the facility was within driving distance of a decent climbing area, which was partially true, and partially the kind of thing people said when the real answer was that they had found a floor worth staying on. Nora drove to the airport on a Thursday morning in her truck with the cracked mirror, flew to Washington on a regional connection through Denver, and arrived at the Senate building at 7:45 the following morning, with a prepared statement she had written in 3 drafts, and a suit she had bought in Caldwell because she did not own one, and because the woman at the shop had said, without any sales pressure, that the dark gray one fit like it was made for someone who stood the way Nora stood, which was a strange thing to say and was also accurate. The hearing room was smaller than what television suggested. The ceiling was high, and the wood was old, and the room had the particular weight of a space where a great deal of consequential language had been produced, some of it meaning something and some of it not, and the architecture did not distinguish between the two. Nora sat at the witness table with three other people, a former Army Medical Corps administrator named Dr. Tell, a veterans advocate named Conroy, who ran a patient rights organization out of Virginia, and a woman named Sergeant First Class Ida Brennan, retired, who had filed a whistleblower complaint against a different VA facility 5 years earlier and had spent 3 of those years in litigation before the complaint was upheld. Nora looked at Brennan before the hearing started. Brennan looked back. Neither of them said anything. It was luck. It was a look between people who had been in different versions of the same room and recognized each other across the difference. The subcommittee chair was a senator from a Midwestern state, a woman in her early 60s named Senator Farrell, with white hair and reading glasses she wore, pushed up on her head until she needed them, and a manner that was direct without being aggressive, in a way that was rarer in that building than it should have been. She opened the hearing with a 4-minute statement about the purpose of the proceeding, not a speech, just an orientation, kind of opening that told you the person giving it had done enough of these to know that the opening was not the point. And then she looked at the witness table and said, "We'll begin with Ms. Vega." Nora gave her prepared statement. It ran 17 minutes. She read it without vocal performance, not flat, not robotic, just at the pace of someone who had chosen every word because it was the right word, and who wanted each one to arrive clearly. She described her first day at Harlow. She described Drace's initial assessment of her. She described the supervised rotation, the reassignment, the scope violation notation, the removal recommendation. She described the 2-day mass casualty response. She described the IG investigation and Arthur Vryn's name at the bottom of a 14-patient list. She described what it meant to work in a facility where the person with the most institutional authority had decided before her second week that she was a problem to be managed rather than a clinician to be evaluated. And then she set the prepared statement down and said, without notes, "The thing I've been asked to address is what a functional system would look like. I want to be honest about the limits of that question." She paused. "I don't think the answer is a policy. I think the answer is accountability that doesn't require a federal investigation to trigger. I think the answer is a structure where a charge nurse who flags a staffing concern in a log has someone read that log within the week rather than 14 months later. I think the answer is a credentialing process that evaluates clinical supervisors on patient outcomes rather than administrative smoothness." She looked at the panel. "I had a combat medic career that gave me training that took years to build and cost the military significant resources. I walked into a civilian hospital and was almost removed from clinical care within 6 weeks by a man who was threatened by what I knew. The waste in that is not just personal, it's institutional, and it happens every day to people who don't have a federal cross-reference protecting them." The room was quiet when she finished. Not the polite quiet of a room waiting to applaud, the different quiet of a room that has received something and is sitting with it. Senator Farrell looked at her over the reading glasses. "Ms. Vega, you chose not to file a formal grievance when the situation at Harlow escalated. Can you speak to that decision?" Nora looked at her. "A grievance at that level would have taken 6 months and generated enough institutional friction to make my position untenable regardless of the outcome. It also would have alerted Drace to the fact that he was being documented, which would have changed his behavior and potentially obscured what the IG needed to build their case." She paused. "I'm not recommending that as a strategy. I'm saying I made a calculated decision based on reading the specific situation I was in. Most people in that situation don't have the background to make that calculation, which is exactly why the system can't depend on individual calculation. It has to have structure." Farrell made a note. "What would you want that structure to look like?" "An anonymous reporting mechanism with a guaranteed response timeline," Nora said. "Patient advocate office with actual authority to review clinical decisions, not just receive complaints. And mandatory external review of any administrative action taken against clinical staff within 30 days of a patient care escalation." She paused. Those 3 things would have caught Drace in year 1. Another senator at the panel, a man in his 50s, who had been quiet until now, leaned forward. "Ms. Vega, your service record was included in the materials submitted to this committee. You have a decoration that was processed 2 years late due to administrative backlog. Is that correct?" "Yes. How do you feel about that?" She looked at him for a moment. It was a real question, not a rhetorical one he was asking, because he wanted to know, or because he thought the committee should hear the answer. She considered it honestly. "I think the decoration matters less than what generated it," she said. The soldiers I treated were real. What happened to them was real. Piece of paper being late doesn't change either of those things. A pause. What it does is tell you something about the systems those soldiers are trusting. If the paperwork for a commendation can sit in a backlog for 2 years, what else is sitting in a backlog? What request for care? What safety concern? What name? She didn't look away from him. The backlog isn't an administrative inconvenience. It's a symptom. The hearing ran 3.5 hours. Brennan testified after Nora with the quiet fury of someone who had spent 3 years in litigation and emerged from it not broken but sharpened, her words precise and documented and drawn from a knowledge of the system that came from having been ground through it. Patel and Conroy added institutional context that filled in what the individual testimonies had framed. By the end, the panel had material that Nora suspected would generate a report that would sit in someone's to-do pile for a while before it moved, because that was how these things moved, slowly, unevenly, with friction at every joint, but that would move. Because the record now existed, and records had a way of becoming actionable when the right person finally read them. After the hearing adjourned, she stood in the corridor outside the room with a cup of coffee she had gotten from the table near the exit, and which was too hot to drink yet. Brennan came to stand beside her. "You've been out what, 8 years?" Brennan said. "About that. And you went civilian medicine?" "Yes." Brennan looked at the corridor, the marble floors, the official portraits, the specific texture of authority that this building was built to convey. "I went advocacy," she said. After the litigation, she paused. "I wasn't sure I could go back into a clinical setting. Too much of the same architecture." "The architecture's not the problem," Nora said. "People in it can be." Brennan looked at her sideways. "Either very optimistic or very tactical." "Both," Nora said. Brennan's mouth moved in something that was close to a smile. "They're going to use your testimony," she said. "Not just in the report. The chair's office called mine last week about a follow-up. They're drafting proposed legislation. Whistleblower protection expansion for clinical staff at federal medical facilities." Nora looked at her coffee. "Marta Ose," she said. Brennan looked at her. "Who?" "A nurse who was pushed out of Harlow 2 years before I got there. Filed a grievance, lost. Left healthcare." Nora looked at the corridor. "The legislation passes. It should be named for someone like her. Not someone like me. I had a cross-reference protecting me." She didn't have anything. Brennan was quiet for a moment. "I'll pass that along," she said. She said it, simply without ceremony, the way one person passes something real to another. They finished their coffee, standing in the corridor, and then they went their separate ways, Brennan back to Virginia, Nora to the airport, and then to Denver, and then to the regional connection that put her down in Caldwell at 9:40 in the evening, where her truck was in the long-term lot, with a parking ticket on the windshield and a cracked mirror that caught the lot lights in a fragmented stripe across the dash. She drove home. She slept without difficulty for the first time in 2 weeks. The month that followed was not cinematic. It was work, which was what her months were made of. And it was the particular texture of a department rebuilding itself around an absence, Dreis's absence, specifically, which turned out to be more complex than the simple removal of a bad actor. He had shaped the floor's dynamics for 3 years, and floors that have been shaped by one person for that long have a period of adjustment when the shaping stops, where old habits surface and have to be consciously re-examined. Ferreira managed it well. Okafor was visible and hands-on in a way that the floor wasn't used to from administration. The 2 agency nurses became permanent hires, a man named Torres, who had previous ICU experience, and a woman named Keiko, who had worked rural trauma and was faster with a crash cart than anyone Nora had seen outside of a military field hospital. In the 3rd week of December, Callum Dreis appeared before the State Medical Licensing Board. Nora was not at that hearing. She was on shift. She learned the outcome at the end of her shift from Darlene, who had been checking the board's public records portal every hour with a dedication that she would have described, if asked, as professional interest, and which was something more personal than that. "Revoked," Darlene said. She kept her voice even. "Effective immediately. Federal prosecution is pending on the billing fraud. His legal team filed for a reduced charge arrangement, but the IG's financial unit is opposing it." She paused. "He will not practice medicine again." Nora stood with that for a moment. Not the triumph she might have expected, the victory, feeling that movies and stories suggested should accompany moments like this. It was quieter than that. It was the feeling of something being accurately named, Finally, after a long time of being called the wrong thing, Dries had called himself a guardian of clinical standards. He had called Nora a discrepancy, a scope violation, a threat to institutional cohesion. The licensing board had called him something else, in formal language, on a public record that would outlast every frame he had ever built around his own reputation. The record was what remained. That was the thing she had always understood about documentation, that it was not about the moment of writing, but about what the writing meant when someone read it later. Arthur Wren, she said. He's in the board's written findings, Darlene said. By name. With the clinical sequence laid out, the equipment downgrade, the imaging delay, the outcome. A pause. He's in the record. Nora nodded. It was the smallest possible justice for a man who had come to a veterans hospital for care and had received something less than that, because the person running the department had a financial arrangement that mattered more to him than the patient in front of him. Smallest possible. But it was there, and it was real. And Wren's name was in a document that a board of medical authority had signed and published, and that document was not going anywhere. The Canine Rehabilitation Program received its funding approval in January. The announcement came through the Army Surgeon General's office in a letter addressed jointly to Harlow Veterans Medical Center and to Nora Vega by name, which was unusual enough that Okafor brought it to her personally rather than routing it through administrative channels. The program would be co-located with the facility's outpatient wing, would serve both veterans in recovery and retired military working dogs, and would involve a collaborative care model that integrated physical rehabilitation, psychological support, and structured handler-animal reintegration for canine pairs, where the handler had sustained service-related injury. Nora read the letter twice. She thought about Farrow telling her that Kodak had good days and bad days. She thought about what happened to working dogs when the structure that had defined their whole existence was removed without being replaced by anything adequate. She thought about what happened to people. The program was not her design. It had been conceptualized before she arrived, was funded through channels she hadn't opened, would be staffed by people with credentials she didn't hold. But the recommendation that had made Harlow a serious candidate had come from Mace's office with her name attached, and the facility's application had cited the 2-day mass casualty response and the quality of care delivered to military patients in that response as evidence of institutional commitment to veteran well-being that went beyond standard compliance language. She accepted the role of clinical liaison to the program, which was an unpaid additional liaison responsibility on top of her trauma nursing duties, and which she took on without hesitation because the work mattered and because she understood, after 8 years of trying to exist in the space between who she had been and who she was, that the work was the space, not a bridge between two versions of herself, the thing itself. Lieutenant Farrow brought Kodak in on the first day of the program's soft launch, a Tuesday in early February when the Montana cold was the kind that made the air feel contracted and precise. He walked the dog through the facility's East Wing entrance, along the corridor that had been converted to accommodate the program's intake area, and into the first consultation room, where Nora was reviewing a case file. Kodak came through the door and went directly to her. Crouched, she put her hand on his head, then his side. He was lean, in good condition, with the alert stillness of a dog who had been moving through a world that was asking less of him than he was capable of, and who had been managing that discrepancy with the patience of an animal that didn't have language for the frustration, but felt it clearly. She understood that. She was familiar with the feeling from the inside. "Partner," she said, "you ready to do something useful?" Kodak's tail moved twice, the same speed as always, deliberate, not eager. The tail of an animal that communicated information rather than performance. Farrow stood in the doorway. "He's been better," he said, "since I told him where we were going today." "Dogs don't understand sentences," Nora said. "I know," Farrow said. Told him anyway. He looked at the program intake materials on the table. "How many pairs are you starting with?" 4. 2 handler dog pairs where the handler is in outpatient recovery, 2 retired dogs whose handlers are in long-term care and can't be primary. She stood. "We'll assess and build from there. What does success look like for this?" She thought about it, honestly. A dog that was pacing, finding something to do with itself. A veteran who had to leave the service early, having a structured reason to get up in the morning. She paused. Those 2 things consistently for more than 6 months. Success. Not a program report. Not a photo opportunity. Farrow looked at her with the expression of someone who had been trying to figure out a thing for a while and had just gotten close to the answer. "You stayed," he said, "at Harlow, when it would have been easier to leave. I had a reason to stay. Dryce's investigation." "Patience," she said. He was quiet for a moment. "Same thing at that point." "No," she said. "They were never the same thing. The investigation was what made the situation correct. Patients were why I was there." She picked up the case file. "There's a difference. If you lose sight of it, you end up making decisions for the wrong reasons." Farrow held her gaze for a moment. Then he nodded once and looked at Kodak. "What do you need from me today?" "Your observations on his behavioral baseline over the last 3 months. In writing, as specific as you can be. Not what he was like on deployment, what he's been like since." "Can do that." "Good." She moved toward the consultation table. "Close the door on your way out. He and I need to do an intake assessment." Farrow left, pulling the door shut behind him, and Nora was alone with the dog in the quiet room. She sat on the floor, not the chair, the floor, because the floor was where you met a working dog on its own terms, and let Kodak settle. He circled once, a small circle, and then lay down facing the door with his head up, alert, watching. She sat beside him without touching him and looked at the same door. Stayed like that for a few minutes. It wasn't nothing. In working dog rehabilitation, the ability to be still in a room without a task was itself a skill, and Kodak had been trained for perpetual readiness in ways that made stillness difficult. Sitting beside him without requiring anything was part of the work. She knew that. She'd learned it the same way. She'd learned everything else in conditions that didn't allow for learning curves, with consequences attached to every mistake, she thought. Sitting there on the floor of the intake room, about the first day she had walked into Harlow, with a manila folder and a cracked mirror on her truck, and a suit she didn't own yet, and a past she had spent years learning how to carry without letting. It defined the shape of how she moved through a room. She thought about Drace looking at her like something he hadn't ordered. She thought about Darlene handing her a schedule she had no reason to accept, and accepting it anyway. She thought about the pen she had picked up in Okafor's office, and the one she had picked up at the Senate table, and the way both of them had felt like the same gesture, not signature as surrender, but signature as statement, the act of putting her name on a thing and meaning it. She was not the same person she had been when she left the army. That was true. She was also not a different person. She was the same person, accumulated. The same instincts, the same training, the same capacity to be in a room where things were going wrong and keep her hands steady, now housed in a different context with a different set of tools and a longer understanding of what tools were for. She had been told, in the weeks since the hearing, that her testimony would matter. She believed that was possibly true, and also possibly the kind of thing people said to witnesses to make the process feel less cold. She had been told that the legislation being drafted would change something. She believed that too, with the same cautious arithmetic that it would be partial, that it would help some people and fail others, and that the alternative to imperfect change was the thing she had watched happen to Marta Ose and Arthur Wren, which was not change at all. She was not a symbol. She was clear on that. The people who called her one, the hospital staff, who had started treating her with a deference she found uncomfortable. The letter from Mace's office, the senator, who had asked how she felt about the late decoration, were doing what people do when they need a shape for something they find meaningful. She understood the need. She just wasn't the shape. The shape was the work. The shape was Darlene's staffing logs in a drawer for years. The shape was Corporal Tate's arm being correctly diagnosed because someone was paying attention. The shape was Reyes's oxygen saturation, climbing on a monitor in a hallway in Montana while a woman with cold hands stood in a locker room reminding herself that she was still standing. That was the shape. It didn't need a name attached to it. Kodak shifted beside her. He put his head down on his forepaws, still watching the door, but the vigilance in his posture had eased by a measurable degree. He was learning slowly that the room was safe, that nothing was required of him right now, that the person beside him was not going anywhere. Put her hand on his back, not moving, just there. He exhaled a long, slow exhale, the kind that came from deep in the chest, the kind that meant the body was releasing something it had been holding without knowing it was holding it. She knew that exhale. She had been working toward it herself, in different forms, for a long time. In the weeks that followed, Harlow Veterans Medical Center ran differently than it had before, not because anyone had declared a new beginning or hung a motivational banner, or held a team-building exercise. But because the conditions that had made it run the old way had been removed and the people in it were filling the space with what they had actually been there to do all along. Ferreira ran the emergency floor with the quiet competence of someone who had nothing to prove. Darlene documented with the confidence of someone whose documentation was now being read. The new nurses integrated into the floor without the hierarchical anxiety that Dreise's authority structure had produced. Because a floor without that structure was a different kind of space, more accountable in some ways, more honest, more demanding in the ways that mattered. Nora worked her trauma rotations and her program liaison hours with the schedule of someone who had accepted that work was not a burden to be balanced against something else, but the primary texture of a life that was, when measured accurately, not a diminished thing, but a specific and meaningful one. She was not happy in the way that was performed. She was satisfied in the way that was real, the satisfaction of being in the right place, doing the right thing with the right people, knowing that it was impermanent and incomplete, and still worth the effort of getting up at 5:45 in the morning and driving in the dark to a hospital in the foothills of Montana. Staff Sergeant Reyes was discharged in late January. Full recovery, both drains out, respiratory function at 92% of baseline and improving. On the morning he was discharged, he stopped at the nurse's station in the trauma wing before he left. Nora was there, reviewing an intake chart. He didn't make a speech. He was not a speech-making man. He put a folded piece of paper on the counter in front of her and said, "Farrow told me about the K-9 program. Put my name on the waiting list. I have a dog at home, not military, just a dog, but she's bored since I deployed, and I thought maybe you'd know something about that." He looked at her steadily. "If you have time." Nora looked at the folded paper. "Come to the intake session in March," she said. "We'll see what we can do." He nodded. He picked up his discharge bag. He walked toward the exit, and at the door, he turned not dramatically, not with the big farewell moment that the scene might have suggested, just turned and looked back at the floor, at the nurses and the monitors and the bay curtains and the institutional light, and his expression had the quality of a man making a private accounting of something, putting a number in a column, moving on. The door closed behind him. Nora looked at the folded paper. She unfolded it. It was a handwritten note, 4 lines, the handwriting of someone who was not accustomed to writing things down. "You didn't have to stay. I know that. Whatever made you stay, thanks for it. We needed someone paying attention." She read it twice. She folded it back and put it in her jacket pocket, not because it was a keepsake, but because she wasn't finished thinking about it yet. She went back to the chart. There was a patient in Bay 3 waiting for a blood draw, and the incoming shift was still 10 minutes out. She picked up a pair of gloves and moved toward the bay, because the work was in front of her, and the work was the point. Kodak visited the facility every Tuesday and Thursday as part of the program schedule. He had, over the first 6 weeks of the program, established a routine that Farrow had stopped trying to predict and had started simply observing. Kodak walked from the East Wing entrance to the program intake area, completed his assessment sessions, and then, at the end of each visit, walked to the emergency department. He found Nora at whatever station she occupied and settled beside her for approximately 4 minutes. Then he went back to Farrow. The staff had stopped commenting on it. It had become part of the floor's texture, one of those small recurring things that a department accumulates over time, that are not in any official protocol, but that people would notice if they were gone. One Thursday in late February, Darlene watched Kodak settle beside Nora at the chart station and stay there in his particular calm alertness, while Nora wrote without acknowledging him, and she said to no one in particular, he found her the first day. Graham, who was standing 2 feet away, said, "Dogs know." "Know what?" Darlene said. Graham thought about it. "The real thing," he said. "When they find it, they stay." Darlene looked at Nora and the dog for a moment. Nora was writing. Kodak was watching the floor with the patient attention of an animal who had decided that this was a good place to be and that nothing was going to move him until he was ready. Darlene went back to her schedule. The floor continued. The patients came and were treated and went home or went to the next level of care, and the machines beep and the shifts changed, and the Montana sky outside the East Wing windows moved through its long winter toward something that would eventually be different, the way everything eventually is. And at the center of it, not elevated, not performing, not carrying the weight of what she had been through like a story she needed to tell, was a woman who had buried her past in a manila folder and driven to a new town and been underestimated by the first authority figure who looked at her and who had decided, quietly and without announcement, that the decision of what she was worth was not his to make. That decision was the whole of it. Everything else, the commendation, the testimony, the program, the investigation, the licensing board finding, Ren's name in the record, Reyes's oxygen saturation climbing on a monitor, everything else was what happened when a person made that decision and held it, even when holding it was costly, even when the easier thing was to set it down and walk away, even in the rooms where nobody was watching. Some things are built in the dark and found in the light. Some people do the work without knowing who will eventually see it. Some dogs remember the people who saved them before anyone else thought to look. Floor does not stop for any of them. The work is always in front of you. The question is only whether you are going to meet it. Nora Vega always met it. That, in the end, was the entire story.